26th. Madam Clerk, I go back to you to proceed with the call to order.
Mayor Brown.
Here.
Thank you. Councillor Carlson's present in chambers. Mayor Crombie.
I'm here.
Councillor Demurla.
Here.
Councillor Dasco.
Here.
Councillor Dillon.
Here.
Councillor Downey is present in chambers. Councillor Fonseca.
Here.
Councillor Fortini.
Here.
Councillor Groves. Councillor Groves.
Can you hear me?
I can.
Here.
Thank you. Councillor Innes.
Here.
Thank you. Councillor Kovac.
I'm here, thank you.
Thank you. Councillor Mahoney.
Present.
Councillor McFadden. Councillor McFadden. Councillor McFadden. Councillor Medeiros.
Here.
Thank you. Councillor Paleshi.
Here.
Councillor Parrish is present in chambers. Councillor Raz.
Here.
Councillor Sato.
Here.
Councillor Santos.
Here.
Councillor Sinclair is present in chambers. Councillor Starr.
Here.
Mayor Thompson. Mayor Thompson.
Here.
Thank you. Councillor Vicente.
I'm here.
Thank you. Councillor McFadden. Thank you.
Thank you. Are there any declarations of conflict of interest? Hearing no declarations of conflict of interest, approval of the minutes.
There are no minutes.
There are no minutes.
Yeah.
Moving on to the approval of the agenda. Madam Clerk.
There are some additional items for the agenda that have been emailed to each of you. I'm going to read out the motion with the added agenda items. That the agenda for the March 26, 2020 Special Regional Council meeting include a communication from the City of Brampton regarding property tax assistance, city response to COVID-19, to be dealt with under Communications Item 8.2. And further, that the agenda for the March 26, 2020 Special Regional Council meeting include a communication from the Town of Caledon providing a copy of the report titled COVID-19 Pandemic Property Tax Assistance, to be dealt with under Communications Item 8.3. And further, that the agenda for the March 26, 2020 Regional Council meeting include a communication from the City of Mississauga providing a copy of a report regarding COVID-19 Pandemic Property Tax Assistance, to be dealt with under Communications Item 8.4. And further, that the agenda for the March 26, 2020 Special Regional Council meeting include a motion from Councillor Santos regarding the region's response to COVID-19, to be dealt with under Notice of Motion, Item 10.2. Just on that note, that is a notice of motion from Councillor Santos that was provided to clerks last evening. It was added here at approval of agenda as a notice. If Councillor Santos wishes to have it heard today, when we reach that item on the agenda at item 10.2, there is a requirement of a 2/3 vote to waive the rules to hear it today. We'll add it as a notice at this point and then deal with it under 10.2. And further, that the agenda for the March 26, 2020 Special Regional Council meeting include a bylaw to amend the water fees bylaw. And further, that the agenda for the March 26, 2020 Regional Council meeting include a bylaw to amend the wastewater fees bylaw. And further, that the agenda for the March 26, 2020 Special Regional Council meeting be approved as amended. Do we have a mover and a seconder? Okay. We have an RTS. Councillor Sato.
Yes, I just wanted to ask a question on the additions on the agenda, please.
Yes?
Do we not have copies of the motions that were passed by the city of Mississauga. I know we had a report on the tax, but I didn't see a motion, a copy of our motion. And also yesterday, we passed a motion on the stormwater issue that is related to the report today on the utility. And I thought that our staff had sent that up yesterday.
Just double checking with staff now, Councillor Sato. I did not receive it. We did not receive it through the clerk's email, nor my email, and nor the deputy clerk's email. So we do not have what you're referring to. We have the communications item referred to in the approval agenda, but we do not have any further documentation.
Can I request then that we add onto the agenda that those items be included in the agenda, and we will ask our staff to send them to you right now? The two motions, one on the stormwater and the one on the tax deferral.
Yes, we can provisionally add them to the agenda so long as they're received in a way that we can distribute them. If everyone checks your emails, we will distribute them to via email to those that are electronically participating, and for those in chambers, we'll give hard copies too. If you could have them send that to the regional clerk email address as soon as possible so that we can facilitate that. Okay?
I will ask our clerk to do that immediately, and I would move the agenda with that amendment. Thank you.
Thank you for moving. Seconder, Councillor Parrish, thank you. This is a procedural email, so or vote rather. Are there any objections? Hearing.
Madam Clerk, Mayor Crombie, I don't have an objection. However, Councillor McFadden was booted out of the system and is trying to get back in. That's what happened in the last roll call.
Thank you. So hearing no objections and seeing no objections via email, motion carries. Thank you.
Very good. That brings us down to delegations. There are none. Item 6, staff presentations. Item 6.1, overview of the March 26, 2020 Special Regional Council meeting, an oral presentation by Nancy Polzinelli, Interim Chief Administrative Officer. Nancy.
Thank you, through the chair. Good morning, Chair Yanika and members of council. Today, I'd like to take some time to provide you with an overview of the region's response to the ongoing and evolving emergency related to COVID-19 pandemic. As you know, this outbreak has had significant impacts to not only residents and businesses of Peel, but has had a far-reaching social and economic impacts across the globe. Regional staff is working to mitigate the effects of COVID-19 and ensure that no one in Peel is forgotten as we navigate through these uncharted waters. Last evening, you would have received our second edition of the update on the regional response to COVID-19 pandemic. Today, I will highlight a few initiatives. Specifically, I will provide you with an overview of the region's emergency response and expand on how we are executing the established protocols on our emergency management program. I will provide a high-level update on efforts to preserve the health and safety of our employees and support them in providing their valuable contributions in these uncertain times. In addition, I will also outline our communications channels development regarding our programs and initiatives as we shift gears to concentrate our resources on essential services and other critical programs. And finally, I will touch on the federal and provincial government's response to COVID-19 and the financial relief measures that are in development. On March 12th, in recognition of the growing threat of COVID-19, the decision was taken to activate the Regional Emergency Operations Center, or the REOC, in accordance with the region's emergency management program. The REOC coordinates our emergency response, communications, liaison, planning, logistics, and administrative supports. The Regional Policy Group, which is made up of the executive leadership team, provides operational, strategic, and policy decisions and resources as required. Staffed by key leaders across the organization, the REOC is operational 7 days a week and meets twice daily and will remain operational as long as required. The REOC focuses on 3 key elements: staff safety, ensuring the health and well-being of our staff; business continuity. It is critical that we have solid plans in place to keep delivering essential services with the resources at hand. And finally, stakeholder communications. We are certainly not alone in this and must maintain clear lines of communications with our partners, whether internal or external. To ensure that the region's essential services are maintained, the REOC has completed an inventory of critical services and is currently redeploying regional staff to high-need service areas as necessary. They also are working diligently on inventory and coordination of personal protective equipment across the organization. To help us respond to public and council questions as quickly and efficiently as possible, we have enhanced our call center capacity, posted the regional COVID-19 website for residents and businesses, continue to share information through social media, and just recently, we initiated the regional clerk email address for council. Through the REOC, there are a number of collaborative tables meeting daily. The purpose of these tables are to collectively plan, share, learn, implement, and communicate. They include the REOC extended table with representatives from emergency management leads and fire chiefs from our local municipalities, paramedics, Peel Police, OPP, and representation from both Trillium Health Partners and William Osler Health System. The communications table has representation from all 3 local municipalities. The human resource table includes the representatives from the 3 local municipalities in the region. And further, the chair, mayors, CAOs, and CEOs of our local hospitals meet daily, and council receives those COVID check-in summary meetings on a daily basis. As I mentioned earlier, the health and safety of our employees is paramount. We are implementing multiple strategies to support our people leaders and employees as we work to address COVID-19 pandemic. Daily updates are being provided to regional staff to share up-to-date information, prevention measures, wellness strategies, and other employee resources to support our team while we navigate through this evolving situation. In order to minimize transmission of COVID-19 and avoid significant impact to the public and our workforce, regional staff are working from home wherever possible. Every effort is being made to provide tools and resources to support work-from-home practices. As well, the region is providing a paid leave of absence of 14 consecutive calendar days for full-time, part-time, temporary, and casual employees who are required to self-isolate or are quarantined and are unable to work from home, and this is retroactive to March 14. We are also assessing options to address the news that students won't be returning to the classroom on April 6 as previously planned, and we will communicate decisions as soon as we can. While essential services and programs have been maintained, there are some regional services and facilities that are temporarily affected until further notice, and other programs that have been developed to respond to the emerging needs within the community. A complete list and description is available and regularly updated on the Peel Region website, coronavirus/affected services website. Further details on program progress is outlined in the regular updates on regional response to COVID pandemic to council on a regular basis. But I'm going to share a few of those highlights from the document you received yesterday. As I said, we are trying to support our regional staff to work remotely as much as possible, and IT has helped to support that increase on our on our internet site. Community partnerships. As we shared last week, a regional community response table has just been struck and has received really good feedback from our community partners. This table is leading the coordination of information sharing, collaboration, and problem solving to support the most vulnerable and at-risk populations impacted by COVID-19. To ensure equitable financial support to our community partners, a criterion has been established to distribute funding based on need. And there is a report on the agenda today, and I know our Commissioner of Human Services will be happy to answer further questions. And thank you to our local municipality partners for providing representation to this table. Community access. It's very important to note that we continue to provide Ontario Work services to our community. We are completing all OW intake appointments over the telephone, and if clients meet the initial eligibility requirements, they are granted OW assistance based on the ministry-authorized risk-based approach to eligibility. Within early years in childcare, Council received an email earlier this week sharing that we have put out an expression of interest for emergency childcare services. That expression of interest was issued on Monday, March 23rd, following provincial changes announced recently. The expression was closed on Tuesday, so a very quick turnaround time, and now the province will need to review and approve our regional plans, and we are hoping to receive a response over the next couple of days. With housing and homelessness, again, Council received a detailed email detailing the work underway under housing and homelessness. And again, thank you to our local municipal partners for their work efforts in helping us develop a homeless isolation program as well as a homeless containment program. And that work is underway. In long-term care is working to ensure adequate staff in addition to redeploying their adult day program staff, as adult day programs have been closed until further notice. We are requesting for additional staff to be made through our REOC, as well as submitted a proposal to the Registered Nurses Association of Ontario. Most importantly, long-term care and ADS staff are working diligently to engage our residents and prevent social isolation, as they are not allowed visitors at the time. And I hope everyone enjoyed that picture of one of our residents, because I know it was touching for me when I saw it. Paramedics continues to focus on essential services and are doing that absolutely amazingly well, as they always do. A key thing to know here is all staff town halls are conducted on a weekly basis. They're hosted by the paramedics chief and the union president, and they have been received very well from staff. TransHelp, we have seen a decrease in service need. However, we continue to provide services for essential trips because our community does need that. Screening measures are in place to protect staff and riders. Certainly, the team continues to ensure that our water supply to our residents and businesses continues to be safe to drink, and very few services adjustments have been made there. For some statistics around call center, so call center, Tier 1 call center has seen a spike in calls, responding to over 2,700 calls each day, with an average wait time of approximately 30 seconds. So amazing work being done there as well. COVID content on our web has seen over 550,000 hits since March 1st, and over 1 million on our social media sites. And I should say the call center for public health, the Tier 2 call center, sees over 1,200 calls every day. So now there will be some initiatives in our work plans that need to be paused until further notice. For example, we are reevaluating timelines for work underway in our term of council priorities, and in consultation with your CAOs, we have put a hold on the police funding allocation work. We will return to Council with an update when the time is right. As I said, this is a constantly evolving situation, and regional staff continue to closely monitor and make decisions daily to adapt to the changes as they arise. To ensure that you, Council, are well informed, we will continue to provide Council with regular updates in different forums and in a timely manner. These updates will outline a range of information on impacted programs and other important information as we navigate through this emergency together. And finally, this crisis will no doubt have a significant impact on the region's finances, as no government will be immune to the shock of the global economy that this outbreak is creating. The path to normal is not yet clear, and we will need our federal and provincial partners to provide much-needed fiscal relief as we address the COVID-19 challenge. Just yesterday, the federal government passed the Emergency Response Act, which will enable $82 billion in financial assistance package. And the province announced its action plan that will see $7 billion in additional resources and direct support, along with $10 billion in deferrals to support the provincial economy. There is not a great level of detail yet available regarding these financial aid plans, and the particular implications for the region have yet to be assessed. We will provide you with updates on the impacts of these supports as more information becomes available. Before I close, I would like to take this opportunity to thank all our staff across the region. This is a group of people, so many of them, that have rolled up their sleeves, that are working 10 to 12 hours a day, and doing their very best work to ensure we mobilize a strong and effective emergency response program. And a shout out to them because they're doing it so well. So thank you to my work family. On that note, we are happy to take questions.
Councillor Santos, you're on the list.
Thank you. Through you, Chair, and hi, everyone. Just a quick question. So now that the municipalities have one allocated staff person sitting at the community response table, is that officially in the document and listed? Because the other day when I was looking at the list of various staff members on the response task force, none of the municipalities were listed.
Through the chair, it's Commissioner Sheehy. At this time, we have only received the name of one representative from the local municipalities, and we are waiting to hear from 2 more municipalities, and then we will update the terms of reference to reflect that participation.
Thank you so much, Janice. So just to confirm that the terms of reference will be updated to include those representatives on the community response table at the regional level. I also wanted to share that there have been a lot of concerns about coordination and collaboration as we all navigate through this at our lower municipality level, but also at the region. And certainly the City of Brampton, when schools were shut down, City of Brampton, Mississauga, Caledon, we all started shutting everything down from March the 12th, 11th, 12th, and 13th. And since then, many of us have been very active on the ground, getting things mobilized and moving in the best interest of the community. So a lot of work has been done on the ground. And now that the region, and thank you very much for all of the work, amazing work of the regional staff, now that the region is also starting to do much of that work, we're finding a lot of duplication, a lot of redundancy, etc., on some of the things that we have been doing in our local municipalities. municipalities. And so I just want to make sure that we are collaborating, that we are cooperating with each other, and we get rid of any silos that exist, because the duplication of work is unnecessary, and it would be really, really great if the region could also work seamlessly with the lower tier municipalities as well. So if somebody can comment and just give some reassurance to us that moving forward, we are going to have that level of coordination and collaboration.
Through the chair, again, it's Commissioner Sheehy. We believe that the best way to ensure that there is open communication and collaboration is to have a representative from the local municipality sitting at our community response table. As all organizations are at this time, we have some limited staff capacity, and if I have to start assigning staff to be on other task force, it is going to take away their ability to respond to the urgent needs in the community.
Okay, thank you for that response. So our issue here is that when residents have a concern, when there's an issue on the ground, or some of our organizations, some of them aren't necessarily on your list, they call us directly as counselors. And so we coordinate with them directly here at the municipal level. So I think it's great to have our representatives sitting at the community response table, but how can we better coordinate with the various initiatives and task forces that are at the lower tier level, just again to eliminate some of that duplication of work that has already been done?
So through the chair, I think I will answer your question in two ways. So firstly, if you are hearing from clients, tenants, residents in the community, they're reaching out to you, please ask them to go to our website, to go through the usual channels that they go through when local councillors and their staff refer issues up to the region. I do believe that having local municipal representation on the community response table is going to be able to ensure that there is clear communication and a clear understanding of what your task force are doing and what our response table is doing.
Okay, thank you very much. I think there's only one piece of clarification that I need, and if all is answered, then I will probably withdraw my notice of motion. In terms of information sharing and data, I know that over the past week or so, it's been very difficult trying to get information and data to everybody in a expeditious way. How can we improve the data and information and transparency that you, like all the work that you guys are working on, whether that's the number of homeless, where the homeless are going to be located, et cetera, et cetera. How can we improve the speed of which that information is shared with mayors as well as councillors?
Through the chair, it's Nancy Polsinelli. Thank you for the question. There are a number of tables, as I've mentioned, that exist, and they exist for the reason that we are working with limited staff, and the paramount reason for their existence is to ensure communication flows. So over and above regular streams of communication like emails, or, which is predominantly emails, at those REOC extended tables, many discussions are had that should, and I'm certain they are, be filtering back to our local municipal partners. The mayor, CAO, CEO meeting is another outlet where we can share information. It may be a little bit different, but it continues to be information. With our communications team, it is the very same thing. Those conversations should be had, and I trust our partners that they will share that information with each of you through your outlets at each of the municipalities.
Thank you, but if it's not being shared with us, we are told that we have to email a specific email address versus an actual person. Is that correct?
So that is the regional clerk email address, and yes, that is for your questions. And yes, we did create that because there is a clear understanding that councillors have questions of their residents. They require immediate response. The difficulty we were having here is hundreds were coming at a time, and in order to deal with all of them as well as we can, filtering them through that website will then allow us to triage those questions and provide either action where action is required or response where response is required.
Okay, great. Well, thank you very much for these updates. It is relieving to hear how the coordination and collaboration with the lower tier municipalities is starting to happen a lot more quickly. If I have any further concerns with that, who should I contact?
So through the chair, I'm going to suggest you go through the email, Councillor Santos, and then again, we can triage your questions as efficiently and effectively as possible.
Thank you very much. And I think I really want to emphasize the importance of collaborating and coordinating with the lower tier municipalities. There have been initiatives and programs that have been in place, and we really don't want anyone to fall through the cracks. I think both the region and the various cities are doing everything that we can, and the more coordinated we are, the more helpful it is for residents. So thank you very much. I have no further questions, and I will be withdrawing that notice of motion.
Thank you, Commissioner Sheehy.
Thank you. Thank you. Through the chair, I did want to just add to the CAO's update. So we are also using the regional clerk mailbox and are sending out program-specific updates, the most recent one being about emergency childcare. And I wanted to take this opportunity to let council know that we are building a specific web page that is information on social supports so that individuals in the community can access that and see what, in one location, what is available to them both municipally, provincially, and federally, and that will become live on Monday. Thank you.
And Councillor Paleshi, you're on the list.
Thank you very much. Just a few questions regarding to the report. Nancy, thank you for it. You had mentioned that the one of the sites that were, I had recently found out that one of the sites for quarantine was added to the area that I represent, and this was the first that I was hearing of it. Could you possibly kind of walk me through how that came to fruition?
Through the chair. So thank you, Councillor Paleshi, for the question. Yes, I'm just looking for my... So you are referring to the containment site that is currently being planned for our homeless shelters.
That's correct. We can be one of those quarantine sites.
Okay, so I'm going to start the response, and then I'm going to pass it over to Commissioner Sheehy. So those conversations did start at the REOC table, extended table, and they also had, a discussion also was had at the mayor's CAO and CAEO meeting. And how we're going to proceed there is it is a phased-in approach. We are commencing in Mississauga and then working to the site in Brampton. But that's how it came to be. So it was a discussion that we had with our local partners in order to find the most suitable site, a site that we can transition or transfer into a containment site for our homeless population.
And through the chair, just to add to this, it's Commissioner Sheehy. During the initial days of the pandemic, we did do a scan across the municipality looking for appropriate facilities. We were very challenged in trying to obtain the right configuration, and so that referral was made to the Emergency Operations Center and then discussed with the CAOs.
Okay, and thank you for that response. And I was just, as knowing, being basically born and I was just really curious as to what Jim Archdeacon Rec Center met in any of the check boxes that other facilities didn't meet. As Jim Archdeacon isn't a very large facility, so I was kind of not very close to the highway or any sort of transit, only one access point. When there's other...
Councillor Pleshy, may I interrupt you for just a moment? It's Catherine.
Sure.
CAO would like to take this matter offline. Naming the facility is not appropriate in public. Can the CAO take this with you offline?
Absolutely.
Thank you.
Sure.
Thank you.
I'll move over. No problem. I'll move over to the other question that I had. Who from the city of Brampton is at the community response table, and when was the community response table first established?
It's Commissioner Sheehy through the chair. I believe, if you'll just give me a moment, I'm going to check my notes. So the community response survey was sent out on March the 18th. The table was in the planning stages for several days before that. I'm going to say we began planning for that table on Monday, March the 15th. And from the city of Brampton, the individual's name is Mikkel.
Okay. The other comment that I had in relation to the motion that has now been withdrawn and other comments around the sharing of data, and just, I guess, I've been involved with emergency management since back in 2014, and I recall a fire chief out of Calgary coming to have discussions, and I think this may have been even at the regional level we had discussions, but it was certainly at the city level that I recall. And the major issue that came out of the fires, the wildfires in Calgary, was political interference. And so I think that talking about information being shared to members of council, I just want to ensure that information and data is being shared with first and priority our Brampton Fire and Emergency, our chief, Bill Boyce, Alain Normand from BMO, and at that emergency response staff level first, and that's the priority.
Through the chair, Councillor Paleshi, yes, you're exactly correct. Those are the representatives that sit on the REOC extended table, and they do have those discussions on a daily basis, so they are receiving that information. Actually, they're part of the discussion in most cases.
Okay, great. Thanks, Nancy.
Thank you. We have nobody else on the request to speak, so we'll have a motion to receive. Sorry, just one moment.
I just wanted to add my comments to yours, Nancy. Your staff is doing an amazing job, and I'm glad that motion's been withdrawn because you don't need any more work. And it's just keep doing it and keep smiling, and I'm sure people are working for you because of your attitude and your pleasantness. So just keep up the good work, and thank everybody on our behalf.
And seeing no other speakers on my list, Councillor Parrish, thank you very much for that. Just one last quick point further to Councillor Paleshi's comment. You know, these are new times for all of us. I think everybody accepts sincerely we're all trying to do our best. It's all new territory for me as well, but the 2 points that I would make is, in times like this, you need structure and you need framework, and that's why we've got our Region Emergency Operations Center. The 3 mayors, and I'm going to say it, and I'll be saying it louder publicly when this is all done, you folks have no idea of all the work your mayors have done on this committee. Oh my goodness, we every day, 5 o'clock, our calls regularly go past 6. Yeoman's work that's been done from Mayor Crombie, Mayor Brown, and Mayor Thompson on all the issues that we're discussing, and several, many more. So they're at the table. Our medical senior folks are there. Your team. it's very difficult to then step away from that framework and start dealing in one-offs. And that's the challenge that we have, because it takes us away from the main focus. And there's quite a few things coming forward that are our main focus. And we trust that going through this hierarchy, you all, this is the local you have folks around the table. We trust they're responding back to you. They're reporting back to you. They're making you aware. But here's my final point. If not, as I asked the mayors yesterday, please let the chair and let our REOC know you could do this better. And I think you've just done some of that now. We are grateful for that, because we're just trying to do our best to marshal our resources properly so that we're not duplicating resources. And the last point I would make, mindful that the region has a unique role in this, because as the upper tier and the purveyors of healthcare and paramedics, et cetera, there's various responsibilities that we're mindful of. But we want to do a better job, and this is why I'm grateful for the conversation. And I conclude thanking Councillor Parrish for her comments, to once again say, great job on the part of our staff and the people, not even thinking, putting in 12-hour shifts and doing everything they can to be present and aware and get us through this. So a very good conversation. With that, Madam Clerk, back to you. Do you need a motion of receipt?
Yes, just a motion receipt,
Yeah, I
please.
believe that would be moved by Councillor Parrish and Councillor Sinclair. The vote to you, Madam Clerk.
Are there any objections to receiving the presentation? Seeing none and having none on the email, it's received. Thank you.
Thank you. Thank you all. Moving on to item 6.2, update on COVID-19, an oral presentation by Dr. Lawrence Lowe, Acting Medical Officer of Health. And I would be remiss before Lawrence speaks to us electronically to not single out the remarkable work that this fella has done for us under very, very challenging circumstances, having more or less just been thrust into the role. He's a credit to his staff, he's a credit to the region, and he's been invaluable around the table. So Lawrence, first I want your colleagues to know, and Micah, the tremendous job that you're doing. If you could please begin your presentation.
Thank you very much, Mr. Chair, and thank you all for the opportunity to present today, and thank you for your kind words. And Mr. Chair, members of council, what a difference 2 weeks makes. For one, I wasn't sitting here 2 weeks ago. I mean that literally, since we're not in chambers, but also figuratively, knowing that Dr. Hopkins has left me big shoes to fill. So I want to first thank all of you for the privilege of serving our community during these tough times. And I'd also like to reassure you that there is an excellent team behind me at Peel Public Health that has weathered many other crises of global proportions, from SARS to MERS to Zika. They've seen it all. I'd like to start with a backstory. This is not my first time being involved in response to a major outbreak. My previous experience was actually far more localized, and it involved a much older foe, measles. In 2014, I was a young medical health officer at Fraser Health Authority in British Columbia. While there, I responded to the worst outbreak of measles in British Columbia since the 1970s. We saw 400 cases in an unimmunized community, and dozens more were hospitalized with severe symptoms. And I can still remember the moment when, despite our best efforts, we realized that the virus had spread into the wider community and even across the provincial boundary into Alberta. There were cases that had defied our recommendations to get vaccinated and to stay home. Some had been out and about in the community while transmissible, and as I mentioned, some had even traveled to the neighboring province in Alberta. Fortunately, as you know, measles has a vaccine that is available to protect individuals, and this is where COVID differs. There is no known vaccine or cure for COVID. And we also know that COVID spreads very easily, which renders all of us susceptible. Now, I will pause to reassure you that the majority of people who contract COVID will have mild symptoms. However, we also know that it disproportionately sickens the elderly and those with pre-existing medical conditions. As seen abroad as well, we know that in many unfortunate circumstances, individuals often succumb. In rare instances, even young people. So now that we are seeing COVID in our community, this is where our current response diverges from my experience in the BC's measles outbreak. we must turn to history. And in history, the way we have always stopped human-to-human spread of disease has been to stop having human-to-human interactions. Viruses cannot infect new hosts if hosts are not meeting. And that is why so much has changed in the past 2 weeks. Like dog years, viruses also have a different timescale. Days for viruses are like years for humans. And this is why we have started to promote significant physical distancing measures heavily in the recent days. When Dr. Hopkins last updated you, the cases we had in Peel were still largely related to travel outside of our region. At the time, you will recall that the big concern was that March break was upon us. As of yesterday morning, we now have 63 cases of COVID-19 in Peel region, and those are counted among over 3,000 cases in Canada and nearly 500,000 cases worldwide. We have also, in the last 2 weeks, confirmed that community transmission is now occurring in our region, like many other jurisdictions in the Greater Toronto Area. This means that COVID-19 is now here in our community. It means that chains of transmission are happening within our community, which are not linked to travel abroad. They are linked to residents here who have fallen ill from exposures that they have encountered. I want to say this that should not to cause alarm, because really there is something that we can do and have been doing: physically distancing. Many of you who have heard me speak elsewhere have heard me state that we are in the midst of a golden window for disease control. For any new disease that we can all catch, the goal is to slow spread through stringent physical distancing when it first shows up. If you slow things down or shut things down before the disease has established in your community, you stop nothing while disrupting social life and daily life significantly. You cannot interrupt transmission that is not occurring. However, once transmission is established, you must start to distance immediately to prevent the disease from spreading far and wide and causing severity. That is the picture we are trying to prevent. We have seized on this opportunity over the last 2 weeks. I was grateful that many in our community heeded our recommendations to promote physical distancing. I've also welcomed provincial and federal steps that have supported our efforts to promote this as well. Notably, in recent days, we have started to see ill patients entering our healthcare system in greater numbers, and regrettably as well, our first deaths in the province. This means that our window for action is starting to close. We must distance, and we must keep this going. I want to be clear as well. We are going to see more cases and more disease severity in the coming days. This should not cause concern, however, because there are things that we can still do. We must self-isolate if we have traveled anywhere outside of Canada, including the United States. Self-isolation means not stopping anywhere between home and the airport. It means relying on a family or friends to get you the essentials. Stay home for 14 days. It also means self-isolating if you feel unwell and have mild symptoms that might be consistent with COVID. Even if you are well, you should stay at home as much as you can. Work from home as your work permits. Cancel all group gatherings, no dinners with friends, no parties, no playdates for the kids, no tea with grandma. Move those into virtual settings as much as possible. Do not venture out unless it is absolutely necessary for groceries, medicine, emergencies, or for just a walk in your neighborhood on your own or in a couple. If you must go out to do essential tasks, I ask you not to linger in a group. Keep moving, keep walking, and stay 2 meters away from others in lines or on public transit. Wash your hands frequently and try not to touch your face. Do not attend healthcare facilities or assessment centers unless absolutely necessary to ensure that healthcare services are focused on those who need it the most. With the disease in our community, we have to assume that there is a baseline risk for exposure with any interaction, any place that we might go to. And as our community does their duty to stay home, Peel Public Health will continue to do ours in continuing our urgent response that we started in mid-January. We will continue to communicate. Our call center will continue to provide guidance and a reassuring voice for residents who need advice or direction. Our website and social media information will continue to proactively remind residents of steps that they can take to protect each other and themselves. Where it is necessary, we will continue, as always, to immediately report on locations where exposure to the public may have occurred. Though it's important to remember that with community transmission now occurring, it's happening largely everywhere. More importantly is to remember that anywhere, any interaction could represent a transmission risk, and ideally, people should be staying home in these weeks for all but the most essential trips out. Peel Public Health will also continue to track down every case that is reported to us in order to interrupt chains of transmission through directing isolation, and we will also ensure, as best as we can, that chains do not establish in our vulnerable and critical populations, such as the elderly, the homeless, the medically vulnerable, and our healthcare workers and first responders. We will continue to use the best science we have to guide our decisions and also address the impacts of this disease through our words, speaking against stigma driven by fear that have disproportionately affected groups in our community, and also trying to speak and curtail to the isolation that many are starting to feel. This is why we've also moved away from using the term social distancing to using the term physical distancing. These times call for us to be social and together in spirit, even if we are apart. Those of us in public health recognize as well that we owe a debt of gratitude to our healthcare partners and first responders for bravely stepping forward to care for those who are sick. We also recognize the workers, the cashiers, the clerks, the transit operators that are keeping essential community services available on which we all depend. And I also recognize those that have done their duty to close their business or those who have taken it in stride to stay home. Your sacrifices will make the difference. And our greatest appreciation to the community for coming together in support of our response is there. Together we will plank the curve, slow the impacts to our healthcare system, and save lives. The actions we take today to manage the spread, in closing I'll mention, will not be reflected immediately, but we must not let up. We must steel our resolve in the face of increasing numbers sure to emerge in the next weeks. I encourage people in the community to not give in to fear and know that there is action that they can take. Their sacrifices today will mean a return to a healthier, happier future. Finally, again, I thank you, Mr. Chair and Council, for the decisive actions that you have taken and the support you continue to lend to our response. We will get through this together. Thank you for the opportunity to provide this update today.
Thank you, Dr. Lowe, and the clerk has provided me with the following list of speakers: Vicente Groves de Merla. Councillor Vicente.
Thank you, Mr. Chair, and through you, Mr. Chair, to the Medical Officer of Health. Dr. Lowe, I want to thank you for the work that you've been doing over the past couple of weeks. I think that with all of the media and all of the Medical Officer of Health and the communications that they have been doing since this really came to a head has been nothing short of remarkable. And it's my view that all residents have a good amount of information and have heard loud and clear what it is that they need to do in order to stem this from getting out of hand. We, of course, get a lot of questions from residents, and we do our best based on the information that we have and what we understand of this to answer their questions. But one question that comes up time and time again is from residents who are concerned that they may have a loved one who, despite the fact that so many people are now either working from home or their workplace has shut down, their family member is still somewhere working every day, and they are rightfully concerned about the health of their loved one who is still working. What is it that you suggest that we can say to residents to in those scenarios where the workplace has remained open and is functioning, and they are still required to go to work, given these circumstances and all of the warnings that we've been hearing?
So, through you, Mr. Chair, and to the councillor, thank you so much for the question. Really, it speaks to the importance for non-essential workplaces as defined in the provincial order to shutter their doors in accordance with that order. I do know that the police have started to enforce and respond to specific complaints. And then speaking to essential businesses, to the extent that they can follow appropriate guidelines to protect both their clients as well as their clients and customers as well as their staff, it is incumbent upon them to ensure that they are practicing things like social distancing, limiting the number of folks that are in a venue, limiting lines, trying to ensure that lines are spread out, all these other pieces, recognizing, of course, that they have challenges with essential. And I would also just ask in general, many business owners who may be essential to really think about how they can also reduce the exposures that might reduce the chance of exposure through reducing interactions. Reduced hours, changes to hours, senior hours, those sort of pieces will both help to protect employees who are on the front line, as well as the customers that might be coming in. So we do recognize it's not easy and it's a balance to be struck. But I think these are some of the decisions that business owners should absolutely be adhering to, and that guidance is available on our website.
Okay. Perhaps through you, Mr. Chair, the region can do a little bit more than to alert folks who are in those essential businesses on what measures they can take. And also, perhaps going back to first principles with respect to safety, I think workers need to be made aware once again of their rights as workers to a safe workplace and their right to refuse work where in those perhaps very rare circumstances, I would hope, they see that safety measures are not being adhered to. Would the Region of Peel and Peel Public Health be able to communicate that message?
Through the chair to the councillor, yes, this is a message that has been communicated to specific inquiries that have come in, but I'm happy to ensure that our website is updated with the guidance that if any worker feels that the workplace conditions are not safe based on the guidelines and recommendations that I have just provided, that they should refuse work and certainly pursue the mechanism through the Ministry of Labour to ensure that they are protected.
Thank you. Through you, Mr. Chair, I have two more questions. And the second one relates to our TransHelp service. We know that both in Mississauga and the City of Brampton, our transit authorities have taken significant steps to modify the service so that the safety of the operators and the safety of the riders is more assured. What are we doing with respect to our TransHelp service? How can we ensure that the operators are protected from potential infection? And given that they are transporting persons who are going to and from medical facilities, what are we doing to ensure that the vehicles are adequately disinfected?
Thanks, Councillor Vicente. It's Andrew Farr here. That's a really good question. So we have put a bunch of measures in place starting several weeks ago, and they've been slowly ramping up over time. We're limiting our trips to essential appointments, medical appointments, pharmacies, and grocery appointments. We are screening all of our riders, asking them the typical questions you would right now. Are you experiencing any symptoms of COVID-19? Have you traveled outside of the country? That kind of thing. We are disinfecting all of our buses daily and limiting the number of riders on each bus to 2. So that allows lots of space around people, lots of space between drivers and passengers. And I'll also say with all of that, our ridership's down 70%. So we're able to manage that, those inefficiencies and make sure people still get to where they want to go.
So through you, Mr. Chair, to Andrew, so the vehicles are being disinfected daily?
That is correct.
Okay. And when riders get on and get off, for example, they may be using handrails. Do the operators have perhaps disinfectant wipes to wipe down surfaces where they may have where folks may have been?
Yes, we've issued cleaning supplies and sanitizer to all of our staff working with anyone in the public.
Okay, that's great. And Andrew, my next question, I guess, would also be for you, but for the medical officer of health. Another question that we're starting to see come up here and there with people, we're not quite sure how to respond. Folks here in Canada see in other countries, in other places, work staff, I would presume, spraying public spaces, almost like a fumigation of these public spaces. What can we say to residents with respect to their concern and requesting that type of service? Is it necessary?
So thank you, through you, Mr. Chair, to the councillor. At this time, we are not necessarily at that stage because we are in the early stages of community transmission. I think many of the images that are seen are typically where you've had a situation where broader community transmission has propagated. So at this time, our goal is really to just promote, as much as possible, the need for physical distancing and for people who are ill to self-isolate and for people who are well to stay at home as much as possible. The idea being that if we slow the spread, the concern about broader public exposures will not necessarily come to pass. In the event that we are starting to see widespread public exposure of that nature, I believe that is a measure that can be taken in terms of disinfectant, and it is certainly something that I know our team is looking at, and I'm happy to take back and see where we are in those preparations. But at this time, our aim is really just to ask people to stay at home.
Okay, thank you very much, and that's how we will go ahead. Thank you.
Councillor Vicente, there is some additional response from the CAO to some of the comments you've made. Nancy?
Thank you, through the chair. Councillor Vicente, in regards to your first question about businesses, absolutely, this is a question that we have been receiving. Further to what Dr. Lowe has suggested, and that is using our website, that does have a page specific for businesses and will provide a number of guidelines and information to support them. This type of question, should you continue to receive it, is a good question to send to the regional clerk email address, so that we will be able to support you in answering that question or getting the right information out to the individual. So please, for all of council, don't hesitate to use the regional clerk email, and we're happy to share that again via email to everyone.
Okay, Nancy, and what would that email once again be for folks who may be listening?
regional.clerk@peelregion.ca. That's regional.clerk@peelregion.ca.
Thank you. Thank you very much.
Thank you. Councillor Groves?
Thank you. Can you hear me, Mr. Chair?
Yes, I can. Yes, I can. Yep.
Thank you very much. Dr. Lowe, I would also like to extend my gratitude to you as well. These are very big shoes, as you said, that you've stepped into, and certainly I think you filled them quite nicely. And as a matter of fact, every time we have a medical officer of health leave us, you've been there for us, stepping in and handling things and keeping business going forward as usual. So anyway, thank you very much for that. As you know, you're welcome. As you know, there's been a business in my community that's had some issues with respect to an employee there, and there's a lot of I guess there's a lot of concerns coming from residents in my community. Some of the questions that they have and concerns that they have is with regards to if someone has been tested positive and they're in a workplace, how long does it take to have that workplace sterile or sanitized and ready for reopening?
So thank you very much, Mr. Chair, and to you, Councillor Groves. In general, what we have on the best evidence is that the virus can last on certain surfaces between up to 24 to 72 hours. This does not mean 72 hours of 100% virus, but the study that was done in the New England Medical Journal that was published showed that there were still remnants of the initial dose of virus seen almost up to 72 hours later. The concerns around sterilization are certainly founded, but it really speaks to the measures that people should be taking in order to protect themselves, which goes to the idea that they should be washing their hands frequently with soap and water, and also avoiding touching their face to the extent possible if they do need to venture outside for any essential reason.
Okay, thank you. My understanding is that that particular business is now, I think they're opened again today. And so given what you just said about the virus being able to survive a lot longer on certain surfaces, like I guess I'm just looking for some reassurances that I can reassure my constituents that they're not at risk and they're able to still shop at that business. And
thanks so much, Councillor, and through you, Mr. Chair. In every positive case that we receive in the community, we conduct a thorough risk assessment, and we work with the individual to determine their movements and people they may have came in contact with, and a whole slew of other details specific to time, places, when their symptoms onset, when they may have been communicable, all these other pieces. In the course of our investigation around the business that you're speaking to, it was identified that this person, at least in the information that we provided, was not actually in the retail section of the area on a regular basis, and certainly not while they were communicable. And so, from that perspective, if the person is not physically there when they are contagious, it follows that there would not be a potential exposure in that setting. Now, obviously, we do rely on our partners in the community to give us information in an appropriate and truthful manner. But based on our assessment, at least in the specific case that you're speaking to, that is why we have determined that, at least at this time, the risk is no different than the existing community risk due to the community transmission that's occurring.
all right, well, thank you for that. And I did put out the correspondence that you did send out, but again, there's still a lot of unrest. And so anyway, we will take this offline, and I'll have some further discussion with you offline. So thank you. Thank you, Mr. Chair.
Thank you, Councillor.
Thank you. And again, Councillor Groves, the CEO, may have a thought on that as well. Nancy?
Through the chair, Councillor Groves, if you would like, we can work with our comms team, our communications team, and they can help provide you with some sound bites, some information that you can then use when you're having discussions with your residents. So you can take that offline and in your conversation with Lawrence, but that is available should you need it or want it.
Yeah, I wouldn't mind having that, Nancy, because there are a lot of things, that's a lot of information going around in the community with regards to this particular issue and this particular incident. And so I would prefer to take it offline and have those conversations with Dr. Lowe and your comms team.
Thank you. Councillor DeMerla.
Can you hear me now?
Yes, we can.
Thank you, Chair. Dr. Lowe, I just want to begin by congratulating you on really one of the most lucid and simple language explanations of, the challenges we are facing and how the virus transmits, and, just very simple language. I was very impressed. So thank you so much for that. There's a theme developing here I can see based on my colleagues who asked similar questions, and I have the same concern, which is we're doing a lot about social distancing, but in those essential services, in those workplaces, it's not clear to me how and who is responsible for enforcement. I did raise one case that I am working with at City Council yesterday, and I was quite properly directed to the Ministry of Labor. But I know that, if I have to call the Ministry of Labor, do a ticket, they come and inspect, there's a time lag. So there has to be a better way of enforcing social distancing at places of work as well. And I think public health probably has a more direct ability, especially to use the bully pulpit. So I see a lot coming out of leadership talking about social distancing in our personal lives. Perhaps we need a similar concerted effort to be used with respect to workplaces. And I really liked what I think it was Councillor Vincente talked about workers knowing their rights and being able to say, this is not safe to work. Now, that's not easy for workers to do because everyone's concerned about their jobs. So I was wondering if it might be possible at the Region of Peel to set up some kind of a hotline where workers could call in and say, this is how I feel anonymously, and perhaps we have a way of checking in. Just some thoughts on that, because I think that this is a real issue. My other point was, is the Region of Peel doing anything in terms of communicating all of our information and messaging in different languages? I just wanted to know, other than, I guess, English and French. And my final question, I know it's a difficult question, but I'm just wondering, in reading and listening to podcasts and reading all sorts of articles on, how this could unfold. And I just wanted to know, based on, I guess China seems to be opening up now, and that's taken them maybe a full 6 weeks, I think. So I just wanted to know, what is your most optimistic estimate in terms of when we will be able to contain this, and maybe your most pessimistic estimate? Thank you.
Thank you very much for the questions, Councillor, and through you, Mr. Chair. In terms of setting up a specific line for employees to call with their concerns, that's something that I may take back to speak with the REOC, the Regional Emergency Operations Center, and all those other pieces. There are questions around our ability to enforce. One of the things that I will start to explore, that I can commit to start exploring, is how other health units are also maybe using their powers under the Health Protection and Promotion Act to enforce social distancing or physical distancing guidelines, rather. So that's something that we haven't looked into yet, but I can commit to actually looking into that, because I think it is very important, and I'd like to hear how my other health partners, as well as any direction from the Ministry of Health, might work around those pieces. In terms of other languages, I am aware that our communications team is currently looking at translation into other languages as much as possible. In terms of media availabilities, I have made myself available as well for specific media outlets here that speak to specific ethnocultural groups in our community, and so I understand at least our messaging is getting out there that way. But certainly, I know our comms team have been looking at the language question, recognizing that we are a very diverse community. And then finally, to your last question around where this is going, it's actually a really important question, because what happens with the case count and the impacts to the healthcare system in the coming days is really going to dictate how long this goes. So in situations like in China and in Italy, where there wasn't, well, actually, maybe I'll step back for a moment and just say, containment is not going to be possible, likely, in the Greater Toronto Area at this point in time. Now, I do recognize that the province of Ontario is still officially in the process of containment, but once community transmission has established itself, it's important to really start, and we're in that sort of phase. I keep talking about that golden window. Our window is closing, where we are now moving towards greater mitigation and really trying to protect vulnerable populations and prevent spread within those populations. And if we are successful at slowing spread, it's essentially like turning off a water tap, right? You're trying, instead of having everyone getting sick at the same time and having it spread massively throughout the community, what happens is you're trying to throttle the tap so that the amount of water flowing can actually be picked up by the healthcare system and actually treated, as opposed to overwhelming our healthcare facilities. And so I think the steps that we have taken right now have hopefully done that. But the challenge is that if we have successfully planked the curve, it means that we will be in these conditions for a longer period of time, because you're trying to spread out and slow the rate of infections across the community over a longer period of time. So really, I'll have a better idea when I provide my update, likely next week or even at subsequent council meetings. But if our physical distancing measures were successful, I anticipate that we will hopefully see a controlled pandemic in our community that will be spread out over a longer period of time, possibly through to the end of the year or beyond. But in the event that we were unsuccessful and we do see a picture in our community, and this is why it is so critical for us to take these steps and to not let up at this time. If we start to see a picture as is starting to be seen south of the border, as well as in other jurisdictions like China and Italy, then this will be over very quickly, relatively quickly, but it will be in a manner that is essentially just turning on the faucet full blast. So in terms of those, I think those are the best time frame estimates that I can provide at this point in time. If we are successful, it should be longer, and ideally it would be longer, just to make sure that our healthcare system is not overwhelmed.
Thank you. So can I just say that two follow-ups for me. One is, Chair, is there anybody at the region who could perhaps shed some light on where we are in terms of ethnic language, public messaging? I know Dr. Lowe suggested that we're looking into it. Perhaps someone has more detail on that. And then my other question, Dr. Lowe, is I have forwarded the particular workplace situation that I'm working on to the clerk at healregionca, and I'm just wondering perhaps if there's a way for us to work on this particular case. It could perhaps be a way to figure out how, if we can figure out how we can enforce in this particular workplace, perhaps it becomes a template for other similar situations.
So thank you, Councillor, and through you, Mr. Chair. I'm happy to take that request through the regional clerk process and explore it with my team. In terms of speaking for the region, I guess maybe I would pass that to the Chief Administrative Officer to speak to.
Through the chair, thank you for the question. So yes, just to reiterate, our communications team is working on materials for other more popular languages within the region of Peel. In addition, the ministry does provide us with some print or some material that is in different languages. And more importantly, with our call center, we do have translation services available should it be required by phone. So that is available to the public.
Okay, thank you. Mayor Crombie.
Got all these buttons to unmute myself. Can you hear me?
Yes, we can.
Firstly, I just want to thank Dr. Lowe. You have really been a calm, steady, reliable voice, and we've really appreciated you stepping up, filling those big shoes you've had no problem filling. Thank you, Dr. Lowe.
Thank you, Mayor.
I'm very appreciative of the numbers coming out in a little more expedited way, not only to the response team and the, shall we call it the 5 o'clock call team, mayors and chairs, but to all of councillors. I know that you could hear from the comments made earlier that they're also craving more information. So I think it's important we do share with them the information we receive, and certainly getting the updates on a sooner basis has been very helpful. I note that they've just come out and we're up 12 cases overnight. That's a lot. It's not as much as other places, but still we should be concerned and still put whatever measures we can to continue to put them in place to flatten the curve and try to contain the virus. You feel that we're moving into mitigation phase from containment phase, Doctor?
So thank you, Mayor Crombie, and through the chair. We are starting to see the end of what I've been calling the golden period of disease control. As I understand it, in the province of Ontario, we are now starting to see people with severe illness presenting in healthcare facilities, and we are also now starting to see our first deaths in the province. So I would say it's probably a matter of days at this point, not weeks, and certainly we don't have the luxury of time to really ensure that we are physically distancing. As I mentioned, the goal is really to try to interrupt transmission once it's established in your community, but before it has spread far and wide. And I think that really speaks to the critical window that we've been acting in at this point in time.
And the deaths that have occurred to date, how many is that in Peel?
Through the chair to the mayor, I do want to clarify that we have had no deaths of Peel residents at this time. However, there have been other deaths in the Greater Toronto area. Yeah.
Largely seniors, people who have traveled, or people with underlying health conditions. Is that correct?
So through the chair, at this time, yes, it has largely been people who have traveled, and also, unfortunately, people who have been in the older phase of their lives.
Okay, so we continue to have groups and individuals, friends. All of us do have friends who are being very philanthropic and either raising money or raising donations. And I wonder if you can share with the group where donations should be sent. I've got many people approaching me that they can access masks, and I'm not sure if they're N95, which are the key surgical masks that hospitals require, but masks or gloves. And there should be a central place for them to be donated, because there are ethical issues. Let's make that very clear with picking winners, picking where donations should be sent. And so we have to leave that to where the most need exists, not the most local facility, shall we call it. And can you share with us, or Nancy, where donations can be sent? And I don't mean donations to the food bank, because obviously I encourage those, but I'm talking when people call or email you saying they know where we could source gowns or gloves or surgical masks.
Thank you, Mayor, and through the chair. This is actually being handled at the Regional Emergency Operations Center, and so I will, if I may, Nancy, ask you to sort of respond specifically as to process.
Yes, thank you, through the chair. So we are in the process of developing a link or an email address to filter some of those requests through to REOC. REOC is also working with the extended table, which includes the hospitals, to help develop inventory and coordination of personal protective equipment for the hospitals as well as the region. So that work is underway. As soon as we have that email up and running, we will send it through to all of council, so you're aware. In the meantime, please continue sending those donations or those emails through to the regional clerk email address, because it is going to help, and we are pulling that information all together so that we can continue to receive PPE equipment. So thank you.
And on the issue of respirators, I mean, there are some private clinics and maybe even some dentist offices. Have we reached out, and who under whose authority, shall I say, is sourcing respirators and other equipment like that we may need?
So through the chair, I'm going to suggest, Mayor Crombie, that those emails or those opportunities are sent back to our hospitals, to Trillium and William Moser Health System. Both organizations have developed a program through their foundation departments with email address that you can access, but respiratories would be with our partners at the hospitals.
Okay, very good. And I thank you for I guess the province came out with the 1-800 number for companies to get to provide clarification as to whether or not they're on the no work list, if they're on the essential list or not. I know that many have contacted me in my office asking me to define for them whether they're supposed to close down, when in doubt, close down. But I've been referring them to that number, and I hope that that has been shared with all councillors that there is a 1-800 or 188 number, I think, for any business that contacts you. Please refer them to that number. You don't want to be in the business of interpreting whether they're an essential service or not, and they should remain open or not. So I encourage all councillors to do. And then finally, on the enforcement front, if there are people who are not abiding by the isolation and the Quarantine Act that Minister Hadju just put into place last night, who are not self-quarantined, and we know that they've been abroad, or businesses that are still open that are required to close, can somebody describe what the enforcement process is, please?
Lawrence, can we start with you?
Yeah, I'm happy to take a stab at this time. Thank you, Mayor, for the question, and through the chair. At this time, I understand that the provincial orders are being enforced by the police. I also received notice of the Federal Quarantine Act being brought down, but I have not yet to date received any information as to who would be enforcing the mandated quarantine period for returning travelers.
Okay, so somebody at some point will reach out to us and let us know how that will be enforced. And what about, so businesses that remain open and individuals not quarantined, we do need to get that clarified, because certainly, I mean, I'm sure I'm not the only one. I'm sure other councillors have been getting messages. My neighbor just came home from Costa Rica and is out doing her shopping, etc. This business down the street remains open, etc., etc. So we need to get that sorted out, so we have a central place to, like a 311 or whatever, to send that information to, so it can get enforced.
Yes, Bonnie, the CAO may have a further thought on that, but we do require greater clarity. I agree. To the CAO?
Thank you, through the chair. Unfortunately, I do not have greater clarity at this point. However, I can share that we have been in conversation with Chief Nish, and with his support, we are working through that to really help understand what that enforcement looks like, because we know we'll be leaning on our police services for that.
Okay, thank you. If that's all, Mayor Crombie, Councillor Downey.
That's it.
Thank you. Councillor Downey.
Thank you, through you, Chair, to Dr. Lowe. Just another set of thanks from Caledon. Your messages have been clear and concise, and I think very calming. I've been happy to have them and share them with my residents, as I'm sure my colleagues are doing as well. And your participation in our teletown hall and our council meeting this week was much appreciated, and I think went very, very well. Lawrence, my question is in regards to essential services, construction sites being one of them, and actually it might not be for you, it may be for staff, but what responsibility do we have at the region to protect workers at construction sites of our own projects? Those sites might be vendors with their crews, but what responsibility do we have to make sure that those vendors are providing a safe and secure website, or a safe and secure work site for their workers? I'm sure you can all imagine that construction sites are not very hygienic at the best of times, and it would be very difficult to coordinate a number of workers in the construction field to, follow 6-foot rules and continue to wash hands in situations where there aren't opportunities to wash your hands or sanitize at the very least. So, it's good to hear about the measures that we put in place for our trans help and those types of things, but what do we do on a construction site?
So thank you for the question, Councillor, and through you, Mr. Chair, I absolutely, if anything, I would echo your concern. I was actually quite surprised that construction sites were included within the provincial piece. I would recommend, and this is to council, that it really be a conversation with the province. I think the Premier has actually come out and made very clear in a lot of his remarks publicly that if construction sites are unsanitary, that he says that they will make sure that labor inspectors will shut them down. So I know that the Premier has made those promises. Publicly, and it may be a conversation to have with the province just to ensure that they are making good on that.
Thank you, Lawrence. I would agree that maybe that's a an advocacy piece that this council takes forward. My sources have told me that the Ministry of Labour is not out actively looking at sites unless there is a death or an accident. So my worry is that we are not necessarily, or that we should be doing the best that we can do as a region of Peel to make sure that our construction sites are being well maintained and that the vendor knows that we need to see precautionary measures for the workers on those sites.
Thank you, Councillor, and actually, through the chair, if I can respond, this goes to the broader question around sites that are still remaining open with the essential pieces, and I am going to explore, as I mentioned, if there's action that I can put in place through the Health Protection and Promotion Act to really outline what employers need to do, failing which that they would essentially be sanctioned and/or shut down. So it is something I'll commit to looking into as to what we can do within my powers as the interim medical officer of health.
Thank you very much.
Thank you. Mayor Brown.
I'll unmute myself here. Thank you, Chair Unica. And I wanted to echo the comments that were said before. First of all, thank you, Dr. Lawrence Lowe, for your hard work. I know he receives endless calls from the mayors and the chair in particular, and he's on our calls every day. And we appreciate your patience. I'd also want to thank you for attending our teletown hall. Dr. Lowe answered questions for about an hour and a half last night, and he was very patient with our residents. A few things that I would like some additional information on, and I think you alluded to a little bit last night on our call. We continue to get complaints. I got more this morning about telehealth, how even though they've added these 130 lines, people can't get through. Is there a local number that we can share for people that have become frustrated with telehealth? They want to get tested, but they want to get the guidance first before they go in. What advice should we be sharing about local options for that? I know you staffed up resources to be able to take calls. Is there a local number they can call that would provide a similar service to Telehealth Ontario?
So thank you, Mr. Mayor, and through you, Mr. Chair. Yes, the Peel Public Health number specific to coronavirus is 905-799-7700, and certainly folks can reach out with questions there. It's also worth noting that we also respond to tweets that are tweeted to the @Region of Peel account, and also that our website is also constantly being updated. I have heard questions around sometimes the information, especially because the website came together so organically. It can be difficult to find information right now. I know that the team is currently looking at a revamp to make it easier for people to find what they need. But even as of now, the information is largely there at peelregion.ca/coronavirus.
So I think one thing would be helpful additionally is just maybe a social media graphic that could be sent to regional councillors with that number that we can share, because I think the frustration over telehealth is one that's only going to grow as numbers increase. So just a simple graphic we can put on our Twitter and Instagram and Facebook to let people know what the local number is. The second thing that I thought would be helpful, and I know you explained it to me, as I've mentioned it to residents, it's a little bit reassuring in terms of the 15-minute transient exposure. I think right now people are very nervous about anything from home delivery of food to even going to Tim Hortons, as was evident on the weekend. So the 15-minute transient exposure, if you could, just like you did last night on the call, if you could explain that to regional council as well.
Thank you so much, Mayor Brown, for the question and the opportunity, and through you, Mr. Chair. So we know that this virus is spread through droplet contact and close contact, essentially, with individuals. This means that you essentially have to be in a prolonged situation with an individual who is actually showing symptoms. There has been a lot of concern around asymptomatic transmission. In many cases, the symptoms of this virus can be so mild that literally it may seem asymptomatic, but it could be someone who wakes up just with a cough and they feel, oh, my throat's dry, and that's it, but that may actually literally be the gist of their symptoms. And so it's important to remember that, however, that it is not through transient contact, but that it is through prolonged close contact with someone who is exhibiting symptoms of COVID-19, which is how this spreads. In terms of that, then, what it means is that many transient exposures, such as transactional encounters with a cashier or things like takeout or delivery, have not been known to spread the virus. And even you can see, essentially, that is why many of those services have been left to continue untouched. A lot of this is based on the evidence that has emerged from China, from other settings that have really shown that the people that are most at risk from a case of COVID-19 tend to be people who have been people who have been in close contact with someone, either a coworker, a family member, someone in the same household, or someone who they've been basically in a private vehicle with or in a close contact with on transit for an extended period of time, because that has built up the required viral load to move transmission. The final point that I would make on this is it really speaks to the need for people to stay home and actually try to limit their interactions. Because some of the symptoms can be so mild, it can be very difficult to actually determine if someone is actually having symptoms. It could literally be, oh, I just coughed because I just happened to eat some peanuts or something, when in reality they may have COVID, and that may be why it's going on. So the extent that people can limit close contact and those sort of interactions right now during these times, that will reduce the rate of spread in our community. But thank you for the question, Mayor.
Yeah, and just the last thing I wanted to flag, more for awareness, is it'd be grateful if your team could put some thought into this. One thing that worries me is that Brampton has one of the largest food processing sectors in the country. I was told by Toronto Global that it's the largest of all the big cities. We have a disproportionate amount of companies involved in the supply chain. And that means that we have many people that are considered essential workers. And so despite the provincial order, we have a large amount of our city that is still working, still operational, where the goals of physical distancing is more challenging. Your team could put some thought to the fact that we have that large cluster and what we could do to mitigate community spread, given that many in our city are integral to the provincial and national food supply chain. Every chicken finger you're eating in the country pretty much comes from Brampton. Every jar of peanut butter that you have pretty much gets packaged in Brampton. And so I have obviously concerns about the amount of people that still have to work because they're integral. And so I just want there to be some awareness and thought put into what additional advice can be given for those in that sector in terms of physical distancing, and whether there should be strict guidance given to those companies that right now feel that they have a bit of a free rein because they're exempt under the provincial order. And that's all for me today.
Thank you very much, Mr. Mayor. And if I may respond through the chair, absolutely. And I think this speaks to just the broader piece that I have committed to around guidance for workplaces and how I might use some of the powers that might be available to me to really compel businesses that are remaining open to ensure that they are taking all measures necessary to protect the health of the public. So thank you.
Thank you. And I think Commissioner Granger might have a thought on that as well.
Thank you, Mayor Brown, for your questions. Just want to respond to the telehealth question a little bit. While we continue to staff up our call center, we are still, as Nancy mentioned, continue to get lots of calls. So when in our information, we'll also send you our website, which has an online self-assessment tool, which may be helpful to some of our residents as well as a wait for our phone calls. Thank you.
Thank you. That brings me to Councillor Parrish.
Yes, thank you very much. Thank you, Dr. Lowe. You've continued to impress everyone. You don't seem to be getting tired, so you keep going. I asked the clerk if I could move a motion today to get rid of the acting, and she told me it was a bit more complicated than that, so I'll wait and find out what the rules are. It's interesting, the numbers we're getting being over 65, well over 65. I'm looking at it, under 18, 3, over 65, 7. Then 18 to 64, there's 65 people, which just reinforces it's people that are out and about, working, traveling. What I'm concerned about is, as I was pulling in here today, there was a young man sitting out on the curb vaping. What does vaping do to young people's lungs, and should we not be telling them to stop doing it while this is going on?
So thank you so much for the questions, Councillor Parrish, and also thank you for the commendation. I will say that this is not my own. As I mentioned earlier, I am supported by an excellent team of public health folks that have been working around the clock since January. So to respond through the chair, in terms of tobacco smoking as a whole, we are still looking at interactions between tobacco smoking, vaping, and COVID. There is still no clear evidence, obviously, that it is a specific risk. However, as we understand it, many respiratory diseases do impact people who choose to smoke, or rather people who smoke. They are impacted in much worse ways, as we know, with other respiratory illnesses such as flu and even the common cold. They have longer lengths of time to recovery. And so, I mean, obviously the advice that we have been stating in public health for decades to quit smoking is certainly still valid. And further to that, especially in the midst of where you have a new and concerning respiratory virus, which actually functions by causing inflammation in your lungs, which is essentially what smoking does as well, I would highly recommend anyone who is continuing to smoke to really give some serious thought to discontinuing practice.
And thank you. And through the chair, I also found it interesting. Several doctors have put columns in the local papers and online that tell you how to distinguish between allergies, which apparently hit on March 20th, and I'm in full blown allergy. The big difference is temperature. If you have no fever, then it's allergies, not necessarily, but more likely. So I've been assuring people that I'm not contagious so far. Dr. Lowe, I don't want to disagree with you, but when you talk about your whole team, it's always been my theory that leadership comes from the top and it influences all the people that work for the leader. So you're doing a really good job, and you are obviously guiding your people very well. The last point I wanted to make was there is a website as referred to with self-evaluation. My son-in-law took it because he came down with a cold. And he said it's very easy to go through, it's very clear, and at the end it says call the doctor or stay home, rest, drink lots of fluids. So he's staying home, resting, drinking lots of fluids. So we do have other ways other than sitting there waiting for somebody to answer a phone. And if you're at all computer literate, which I'm not, which is why I'm here today, you can go through that self-evaluation. And I think it's a really good tool. And I thank everybody for putting that online, because it obviously takes a lot of pressure off the phone calls. And that's all I have to say. Thank you.
Thank you. Councillor Paleshi.
Thank you very much, Mr. Chair. Thank you, Doctor, for all the work that you're doing. I really enjoy listening to every time you speak and all the information that you're providing. Just in relation to some of the comments that Mayor Crombie and Mayor Brown were speaking to, and to give a little bit of an example, we had a resident that was feeling under the weather, called Peel Public Health. Peel Public Health advised that the resident call back if they were having any shortness of breath. Their indication to me was that it took Peel Public Health, and maybe they're getting confused with telehealth, and that's the clarity I'm looking for. It took them 2 days to reply back to the resident.
So thank you very much, Councillor Paleshi, and through you, Mr. Chair. I obviously don't know the specific details of this case in particular, but I do know that we have seen an unprecedented amount of influx into our call center. That's not to make an excuse, but that's to provide a bit of an explanation. It certainly sounds that if the resident in question perhaps had a mild illness, the recommendation at this point in time has really been, as I stated at the outset, if you are sick, you should be self-isolating and staying home. I don't necessarily know if that was the advice that came 2 days later, but certainly I would encourage folks to still reach out to us with concerns, but also try to see if they can get some of their questions answered online or also through social media channels, which we do respond. I do know I've seen a number of tweets come through, and we have been sending direct messages as well as able. And hopefully, one thing that I will mention, one of the challenges that we've had with calls has been for people to obtain their test results. There is a little bit of a lag with testing, just as the public health, as the province ramps up to address the significant interest in number of tests that are taking place. But I've been led to understand that the Ministry of Health is intending to put these on the electronic database that manages test results in the province, and that these results will eventually be available online. And so the hope is that once results are available online, that will go a long way to addressing some of the volume of calls into our call centers, and then hopefully this situation will not, these longer wait times will no longer be part of the day-to-day.
Sure. Okay. And thank you for that, Dr. Lowe. And I guess now the resident is experiencing shortness of breath, and unfortunately doesn't own a vehicle, was about to call a cab, which we kind of suggest them not to do. I guess what I'm looking for, and going back to Mayor Crombie and Mayor Brown's comments, is just the information that's being provided on what a resident is supposed to do next. And I think kind of the non-emergency number, I know the paramedics are doing a fantastic job in everything that they're doing. And so the self-assessment is where we directed them. They did not want to make another phone call because they didn't want to wait 2 days. And the influx of calls that we're receiving has been a problem, but we're addressing that hourly. What do you suggest the next steps for that person to do?
So thank you for the question, Councillor, and through you, Mr. Chair. It's not typically the most, so for an individual who doesn't have a private vehicle or someone who is a close family member that can take them, which is obviously the preference in terms of attending at an assessment center, the recommendation is for them to actually take a taxi, and basically to ensure that they are masked in the taxi and with the window down. This is the least worst option compared to other issues such as was mentioned in terms of things like transit or all those other pieces. So if you think about transit versus paramedics versus having them walk, unfortunately there are limitations, and I will share that prior to coming into the interim role here, I did also serve as the Associate Medical Officer of Health that worked on the built environment, and this really speaks to a lot of the challenges that we have had by creating a community that is very dependent on motorized transport as opposed to being able to walk. Although arguably in the midst of the infectious disease period that we have here now, it has also helped with transmission dynamics and limiting interactions. So a little bit from here, a little bit from there. But the challenge is, unfortunately, if you consider all the other options that person may have in order to get assessed, save and except for a private vehicle or someone that can take them, it really is probably best to have them masked in a taxi with the window down, and also the driver aware and masked as well. Understanding as well, as I mentioned, that transient contact and reducing the possibility of droplet contact is essential, and that unfortunately is the least worst option for transport in a situation like that.
Okay, Commissioner Granger, did you have a thought on that as well?
Through you, Mr. Chair. Yeah, I just want to reiterate as well, if anyone continues to have symptoms that persist, we do encourage them to seek treatment all the time. So I just want to reiterate that. There's new information that's coming to the ministry every day that we take our first half an hour before we start with our calls to go over with staff. So there is lots of new information coming through every day. So we do take some time to update them, but certainly if there's symptoms, we encourage them to seek treatment. Thank you for the question.
Thank you. Brings us to Councillor Kovac.
Thank you, and through you, Mr. Chair. Just want to thank you, Dr. Lowe. First, I probably should ask, can everybody hear me?
Yes, John. Yes, John.
Thank you, Mr. Chair. So, Dr. Lowe, thank you for the presentation, and thank you also for last week for participating in the mayor's telephone town hall, which also went about an hour and a half, and it was great to have you there to answer questions, and we got a lot of positive feedback, my office did, in the form of emails and phone calls from members of the public. I just wanted to touch on businesses being open, those listed as essential, and then specifically construction sites, because there's a lot of construction happening in Mississauga in the downtown core, obviously in Brampton as well, and then other parts of Peel region. But as somebody who used to work in construction myself, probably beginning at the end of grade 10, it was every year for about 2 months in the summertime throughout university. And I could say by their very nature, construction sites are not very sanitary. They are dirty and unclean, at least by my estimation. Regularly no access to water to wash up and even use the bathroom. And this would be if it would be, I'm talking right now specifically commercial high-rise, and this would be on sites in downtown Toronto or anywhere. And I would regularly use the outhouse. Good luck finding water. And this would be insulation work that I would do, drywalling. Mainly I was a drywaller, a little bit of metal studs work as well. And also I could say a bit of a stereotype, but the type of people who tend to work in construction are a little rough around the edges, less fastidious, and caring about being cleanly while working. So I would just sort of ask right at the end, how do we balance keeping people safe at this time while balancing the economy and ensuring that people are still employed and able to go out there and do their thing as far as working and collecting a paycheck to feed themselves and their families.
So thank you, Councillor Kovac, and through you, Mr. Chair. I'm not an economist, so I can't necessarily speak to the broader economic impact that this is meant to have. What I can speak to is the recognition that there is a lot of there are a lot of sacrifices being made by businesses in our community, and I mean, I think I recognize that together with all of us who are in public health and also the region in terms of trying to really turn the tide around this virus. The thing that I would highlight is my earlier comments. I believe it was to Councillor Demerla in terms of the picture and how long this could go. And I think if, you know, and again, I'm not an economist, but really you would have to weigh what are sort of the economic impacts if we had a picture similar to jurisdictions that have gone before us with significant propagated spread throughout the community, lots of lives lost, and lots of people also left with essentially the trauma of having been through this experience and those impacts on the economy versus essentially a slowdown, largely a slowdown, even maybe a brief stoppage ideally, but with most of society essentially returning after a pause, but knowing that those may actually last, that a slower pandemic might actually last longer. So that's something for folks who know way more about money than I do to account for. But I think it really goes back to the idea of trying to figure out what that picture would look like depending on how the pandemic unfolds in our community and whether our measures are successful.
Thank you for your comments, Doctor.
Okay. CAO, a further comment on that. Nancy, please.
I just, through the chair, I just received a message from Commissioner Van Offwigan. We are bringing a fiscal update to Council on April 9th, and I think at that point we'll have a better understanding of what the economy looks like for the region of Peel. So more to come on that.
Okay, with that exhausts my list. Excellent conversation. Very well done, Dr. Lowe. Which brings me then to our final staff presentation, item 6.3, Region of Peel measures to provide financial relief for taxpayers and ratepayers and to support local municipal measures COVID-19 pandemic. Presentation by Stephen Van Offwigan, Commissioner of Finance and Chief Financial Officer, related to reports 8.1, 11.1, and 11.2. Stephen.
Good morning, Chair Unica and members of Council. So joining me today on the line is Stephanie Nagel for technical questions, as well as Steve Fanton, who's in Chambers, is the Director of Operations Supports in Public Works. So they'll be able to handle any of the technical questions related to property tax and or the utility rate. So a year ago, together with Neil Johal from the Mowat Centre, we presented to Council on the subject of the changing nature of employment. At that time, I suggested that with today's technology, I could make my council presentation from anywhere, preferably Costa Rica or Mexico. So how quickly times have changed. We are now holding our first virtual council meeting. Today, I will provide an overview of financial relief options for council's consideration. Next slide, please. Before getting started, I will provide a brief update on highlights from yesterday's Provincial Economic Update, which are most relevant for today's discussion. First, the province announced that the property tax reassessment scheduled for 2020 and to be used for the 2021 taxation year will be postponed. The province will work with municipalities and AMO to determine when the next reassessment cycle will take place. Second, I'm very pleased to acknowledge the province listened to municipal input and has announced it will defer the June and September education property tax installments by 90 days. The deferral will provide local municipalities with additional financial flexibility over the remainder of the year. While not highlighted, the province announced some additional funding for public health units, service managers. We will be providing further updates when we come back to Council on April the 9th. We don't have the details yet. Next slide, please. As COVID-19 has evolved into a pandemic, many Peel residents and businesses are facing financial hardship. All orders of government, including the region and our local municipal partners, are committed to supporting the economic health of our community. As you know, many financial measures have been announced to date, and the situation is fluid with new announcements coming out daily. Council's oversight of Peel's financial sustainability is providing the financial flexibility to respond appropriately and quickly with financial relief measures for Peel residents and businesses. Next slide, please. In Peel, the property tax bill is collected by local municipalities and funds regional and local municipal costs as well as the education system. Local municipalities have jurisdiction over tax collection policies, and as such, it was important for Peel Council to know the local decisions first. Next slide, please. Many municipalities across the province are assessing options for property tax relief. Decisions are varying by municipality. Within Peel, all three local municipalities have approved property tax and other financial relief programs. Mississauga last week, Caledon on Tuesday, and Brampton finalized their plan yesterday. These decisions were informed by local circumstances, including payment due dates and technology limitations. Each municipal program aids the community in this difficult time. This slide outlines the essence of their decisions as they impact the region of Peel. Next slide, please. Naturally, local municipal decisions to defer payment of property taxes has implications for the region of Peel, as each municipality is requesting the region to amend its tax levy payment schedule. Staff estimate the financial impact of aiding municipal cash flows to be in the range of $2.8 to $3.4 million. Peel stabilization reserves will be utilized to cover the cost of the proposed measures. Throughout the development of staff recommendations, Stephanie engaged each of your local municipal treasurers. Based on this collaborative approach, the recommendations outlined in today's report have been designed to satisfy the requests of each local municipality. Next slide, please. With respect to Peel's utility rate bills, we are proposing two solutions for Council's consideration. First, that the scheduled April 1st rate increase of 7.2% as approved in the 2020 budget be deferred for 90 days at a cost of $4.6 million. Second, that we defer late payment charges for 91 days for those that are unable to pay at an estimated cost of $650,000. Mississauga stormwater charges are also collected on the utility bill. As such, regional staff are discussing a process for remittance to the city due to this change in billing administration. It is anticipated that the region would pay what we have received based on the original due dates and request to pay the remaining balance to the city 91 days later. And I believe there's a motion on the floor from City Mississauga from yesterday on this matter. The cost of the utility rate relief measures will be funded from available rate stabilization reserves. Next slide, please. Staff have also identified 2 additional measures for Council's consideration. First, transit fees are reduced to 0 based on AODA requirements to align with local municipal decisions on public transit fares. The cost is outlined on the slide at $75,000. Second, staff will discontinue active collection of overdue invoices and suspend interest charges for 90 days effective April 1, 2020. Both options are not financially material to Peel's revenue. However, they will aid in supporting our community. Next slide, please. In summary, the proposed measures outlined in the report will support the economic health of our community. Peel's track record of strong fiscal management can be leveraged at a time when it matters most. We do, however, require and expect the province and federal governments to step up and support municipalities with additional funding. On April 9th, we will bring back a more fulsome fiscal update, including the impacts to the economy, to inform decision-making related to both 2020 as well as to inform the process for the 2021 budget. Thank you. This concludes my presentation, and we are pleased to take your virtual questions.
Thank you, and I have a list, but what I'm going to do first, pardon me, is have the clerk read the motion that is before the chair on this matter, so everybody will know what you are speaking to, and then I will go to my list. Madam Clerk.
Thank you. The changes to the collection of regional interim and final levies from the local municipalities presented in the report of the Commissioner of Finance and Chief Financial Officer and the Commissioner of Public Works, titled Regional Measures to Provide Financial Relief for Taxpayers and Ratepayers and to Support Local Municipal Measures COVID-19 Pandemic, be authorized. And further, that there be a deferral for a period of 91 days of the imposition of the late payment fee applicable to late payments of utility bills for those payments due on and after April 1st, 2020, to and including June 30th, 2020, and relief from the imposition of the late payment fee altogether, where late payment is made in full on or before the conclusion of the 91-day deferral period. A deferral on the water and wastewater rate increase scheduled for April 1st, 2020, with the increase as deferred to take effective July 1st, 2020. A revision of the fees applicable to TransHelp services to nil with retroactive effect to March 21st, 2020, until such time as My Way, Mississauga Transit, and Brampton Transit, or one of them, resumes charging fares for their services. A variation of the regional corporation's accounts receivable terms so as not to charge a monthly penalty on outstanding accounts receivable for the period from and including April 1st, 2020 to and including June 30th, 2020. And further, that the bylaws necessary to give effect to regional councillors' directions be presented for enactment at the first council meeting at which such bylaws can be presented for enactment. And it should be on your screens as well if you're on by Skype. Thank you.
Okay, and Madam Clerk, to be clear, on my screen, I see that it has been moved by Councillor Sato, and I would like a seconder so that it's duly before us. Do I have a seconder for that motion? Councillor Downey. So it's before us. I have a list of speakers. Groves, Fortini, Sato. Councillor Groves.
Thank you, Mr. Chair. Just a quick question, Steve, through you, Mr. Chair, to Steve. With regards to the deferral of property taxes, I know that we just did that at our council meeting on Tuesday, and we did a deferral of 2 months. I think Mississauga did 3, if I'm not mistaken, and Brampton's at 5 months. So I guess I'm just wondering, with regards to the school board, and I know that that was a discussion we had at our council meeting, and I know the mayor is working with our MPP with regards to the school board agreeing to the deferral. So is the region in communication with the school board on the deferral?
So thank you for the question through the chair. In the provincial economic update yesterday, they announced the deferral of the June and September installments by 90 days. So the province did in fact make that announcement yesterday to coincide with the deferrals that the local municipalities were asking for.
Oh, that's good. Good to hear. And so for those municipalities like Brampton that have deferred 5 months, how does that work?
I might ask, I'll do my best to take a little bit of a stab at the Brampton policy is a little bit different than a full deferral. They, as I understand, they still will be collecting for those who are choosing to pay or can afford to pay, and they're giving the option for those who can't afford to defer that payment for interest-free, penalty-free for up to 5 months. And I'm going to ask that Stephanie Nagel, who has been in discussion with the treasurer at Brampton, to provide a little bit more detail.
Okay, thank you.
Thank you, Steve. Hopefully everybody can hear me. Yeah, every municipality so far has a little bit of a different approach. In terms of the city of Brampton, the 5-month delay piece is really about the current bill that's coming. So there was a bill due March 18th, and then there's another bill coming due in April. And so the 5 months is from the March 18th billing time frame. They didn't change their due dates in their system for that, but they are allowing for customers to come off of pre-authorized and other forms if they're already set up for that. The intent is that they would waive interest and penalty for that period. Along with that, however, I believe at the meeting yesterday, they also included some changes to final due dates for the residential sector to align them with the non-residential due dates, and also to provide for a gap between when the penalty and interest would stop being waived and the next payment. So originally the schedule had payments in July and August, which are now being moved out to, I believe, September and October, or somewhere around those lines. They are in, we've addressed those within our within the policy. So today the bylaw that you'll see for interim levy addresses the 5-month deferral, and on April 9th we're bringing forward our final levy bylaw, which will address the changes to tax due dates for the 3 municipalities. So we do have for Caledon, we do have the 2-month deferrals, and I have been working really closely with the treasurers at all 3 municipalities, so I would like to thank everybody for that, because it does allow us to get this the way that works for everybody locally. But on the school board side, the payment deferrals would be the same for everybody, no matter what your policies are individually, but that 90-day deferral on both payments is very welcome news.
Okay, yes, it is. Thank you very much for the clarification. Thank you.
Thank you. Councillor Fortini.
Thank you, Mr. Chair. I think I was asking the same question as I've noticed we did 5 months, Mississauga did 3 months, and how is this going to compare now with the school? How do we break this down? After the 3 months is over, how do we break it down? So I think I got clarification. I just wanted to ask one question. Reading this thing, is it if someone's late on penalties after this certain time, is it 7.2 interest? Is that what we're charging?
Through the chair, thank you for the question. The 7.2% was the scheduled rate increase that was approved in the 2020 budget that council approved back in late last year. So that was scheduled to come into place on April 1st. So we are recommending that we defer the actual rate increase for 3 months, recognizing it might be a bit of a slap in the face for those who are being hit so hard with the COVID-19 to impose the rate increase at this point in time. So we're recommending that we defer it. It does come with a cost of $4.6 million, but we believe it's the right thing to do.
So that's what, okay, so that's only for 90 days. After stays the same at 7.2 for late penalty and interest.
I will ask Steve Fenton, who's in the audience there, to explain the late payment charge piece. So the 7.2 is just about the rate increase. The late payment charges, I'll turn that over to Steve Fenton to respond.
Thank you. Through the chair.
On our utility bills, there's no interest charges actually applied. It's actually a one-time 2% late payment charge that's applied once the invoice is overdue.
Okay, thank you. So how are we gonna do this? Like, so if Mississauga did 3 months, we did 5 months. So the extra 2 months that we get, so we only waiving the city portion. They still have to pay the region and the school board portion. Am I correct?
Through the chair, the decision-making with respect to utility rates is independent of the decision-making on property taxes. So on the property taxes, we're providing relief by adjusting dates to support the local municipal decision-making on property taxes. The utility rate is independently and separately billed by the region appeal.
Right, okay, I see what you're saying. So at the end of the 3 months, once the 90 days goes by, or the 60 days, the 2 months, which the province set for the school board, we can only waive our portion, the extra 2 months. The rest has to be paid by the residents. Okay. Thank you so much.
Councillor Sato.
Thank you, Mr. Chair. Am I on here?
Yes, you are.
Okay, thank you. I know we're all asking because we're not sure at our end. Just a couple of points on this. Just a bit of a clarification that with regard to the tax issue, that Mississauga, we are still allowing residents, if they wish to pay on the existing due dates, they may do so. But we set ours at 3 months because staff explained that all of the taxes must be collected before the end of the year. And by deferring 3 months, we also deferred the final 3 payments as well in order to accommodate that we would still have those payments coming in before the end of December. So with regard to, first of all, I want to thank you for the recommendation on TransHelp. I think it's very obvious that we need to help those people that are using TransHelp by waiving the fees during this time, and that's a very responsible move. With regard to the utility bills, you have mentioned in the report that by deferring the payments, or I guess you're not using the word deferring the payments, you're deferring the late payment charges, which is basically the same thing. There is providing the one-time relief is estimated at $650,000. Can someone clarify, is that from a loss of overdue payments, or is that just a deferred payment amount? Is it totally lost, or will it be recovered when payments come in?
So through the chair, that would be a lost source of revenue, as we would suspend applying a late charge to any account that's past due. So we wouldn't go retroactive and tell them they have to pay their late charge. We would start with a clean slate for those customers who became late past due during the 90-day time period.
Okay, so I'm still not clear on that, because if I'm not sure why you're saying it's going to cost us, because they are still going to pay their bills. Let's assuming we give this deferral so they don't have to pay their bill, which I want clarification that that's what we are saying, that we are deferring that they will not have to pay their bill on those due dates, that they have an additional period of time before any penalties might accrue. So I don't see why we would be losing roughly just over $500,000.
So through the chair, I'll ask Steve Fanton to provide the details, as it was his team that actually did the calculations, and he'll answer that. Thank you.
Yeah.
Thank you.
Through the chair, it's Stephen Fanton here. The $650,000, the majority of that amount is actually the cost of not receiving the cash earlier. So by receiving the cash 90 days later on the actual bill, there's a cost of not being able to have that opportunity to invest that money into different forms of investments. The majority of that cost is actually the cost of receiving the cash later on.
Okay, so it's just lost interest. Well, not just, but it's lost interest. That's fine. That clarifies that.
Correct.
So how are we going to communicate this information to residents, because when we brought in our tax deferral, there was a lot of confusion because people were saying, do we have to apply for this? You know, what if we want to continue to pay? How do we find out? So what communication plan is the region putting in place to advise residents? And my second part of that question, if the bills are sent out for the next due date, which I think you said was April something, then between April and June, will the new bills that are going out show the new deferred payment date?
Thank you for the question through the chair. I think you're speaking specifically to the water wastewater bills. Is that correct?
Yes, I am. Yes.
Okay, I'll ask Steve Fenton to, as they've been given some thought as to should council endorse this, how they might go about educating the public on it. Thank you.
Thank you. Thank you.
Through the chair, so we're not actually changing the due dates that's on the invoice. So those that choose to be able to pay within our normal terms of 21 days can continue to do so. We're just, again, as we mentioned earlier, we're just deferring the applicability of that late payment charge. In terms of communication, obviously we leverage the region's website and other forms of social media, as a lot of the other locals have as well. We're looking into seeing whether we can have a separate mail out to our customers as well, informing them of the change in applicability of the late payment charge.
So you're not going, I understand not changing the due date because that will be on the bill. So let's say you have an April 1st due date, just for terms of using something. If I receive a bill and it says, as of April 1st, pay this amount, then there's the other box that says, if paid after such and such a date, this is the amount, which is that additional charge for the late payment, the 2% late payment charge. Can we not change that second box to reflect what we're passing today?
That's something we're going to have to look into. I apologize, this is something that's been happening in real time. That's something we actually are looking at doing. I just can't comment on the feasibility of it just quite yet. But we are going to look and try and make this as transparent as possible.
So at the same time, yesterday at Mississauga, we passed a motion to defer the payment, and the wording was to defer the payment of the stormwater fee, which the region collects on our behalf. So I'm wondering how that is going to be reflected on the billings that are still going to go out from the region, and how is that going to be managed? And I know our staff, thank you for letting me add those motions onto the agenda, and I know staff sent them up and they were distributed by email to all members of council.
Yep. Through the chair, the communication of the stormwater charge and the deferral of 90 days, that will be part of the overall communication because everything on the bill is being pushed out 90 days. There isn't a separate communication on stormwater by itself. Obviously, behind the scenes in terms of how the region remits to the city of Mississauga is all behind the scenes. But from a customer perspective, everything on the invoice, the late payment charge will be applied 90 days later. There's nothing different on stormwater.
Okay. Yeah, I would recommend that you meet with our city, discuss with our city staff on that, because I think our motion was worded differently than what we are wording today. And I'm not sure that the two are in full alignment, but I will leave that to staff to work that out because obviously it can be done. But we found when we did the tax deferral a couple of weeks ago that residents, there were numerous questions that were being asked, and we had our staff post a web page on the city website with facts regarding the tax deferral and answering the questions that we were hearing. So I would suggest that that we do that at the region as quickly as possible, because otherwise we as councillors and I'm sure regional staff in the call center are going to be inundated with questions once we approve this today. Thank you.
Through the chair, and we'll certainly take that as direction. Appreciate it.
And Councillor Sato, just for complete clarity, the motion that I have before me, the salient clause reads, and that the Region of Peel Council establish the method as to how to this deferral will be provided for on the water bill. I actually mean council working in conjunction with the local municipalities and the staffs. That's the flavor of how we're going to get there. But just to be clear on what it reads, but it's understood to mean with our partners to work to the effective outcome. Thank you.
As the mover, Mr. Chairman,
Yes.
I would ask that perhaps that wording that you just said in coordination with the local municipalities be added in.
Yes.
I'm having trouble scrolling on my iPad right now, so I'm just looking at it in the report.
That's why I wanted to bring it up so that you were clear, and I think as you've spoken, it would be appropriate to add that additional clause.
Okay, great. Thank you very much. That's all.
Thank you. Councillor Raz.
Thank you very much, Mr. Chair. And I just want to be crystal clear. We are not, because we're deferring the late payment fee, that essentially means that this is a deferral. It can be a deferral of payment, but should people want to continue paying their bill, if they are able to, they're welcome to.
Through the chair, yes, that is correct.
Okay, and one other point of clarification, if people, because you've heard from the City of Mississauga, for the stormwater charge, if they don't pay their water bill, they're not going to accrue interest on that stormwater piece.
Through the chair, I'm going to ask Steve Fenton to ask that, but my understanding is it's a combined bill, so it would be quite difficult to apportion what revenue goes to what component of the bill, but I'll let Steve answer in more detail.
Through the chair, that's correct. Either the customer pays their invoice or not. Normally they don't pay the stormwater component and the remainder separately. Normally it's kind of all or none. So the 2% would generally apply on the entire invoice, including stormwater.
Okay. And from a billing perspective, I having worked in the utility industry previously, the simplest things may not be to just change a box on the bill, because I know that there would be a lot of testing involved. So perhaps a simple bill insert to go with the bills and the electronic bills probably be the simplest solution, given that there's a lot of awareness about what is going on, so people wouldn't be surprised if they have that additional information in their hands. That's my 2 cents. Thank you.
Thank you. Mayor Brown.
Just unmuted myself here. I just wanted to say I think this is a great first step, and I'll certainly support it. But I also think we need to have our eyes wide open that we're not going to be back on our feet in 3 months, and that this is a topic we may need to revisit down the road. A longer extension may be required. You know, when I had my first discussions with Dr. Lawrence Lowe, and maybe if he's still there, he can talk about how long this is going to have ripple effects. But you know, I keep on being told that we could be in the 6 to 8 month range in terms of the ongoing effects of this. And if businesses are going to struggle for 6 to 8 months, people aren't going to be in a position to be able to pay their property taxes. And so I think if the finance staff can have that in the back of their mind, how we function without collecting this tax, which could be a longer period than we're anticipating. I know it would be wishful thinking to say that this is going to be over in a few weeks, but all the evidence we're getting suggests that you know, there's going to be pain for a lot of people for an extended period of time. I'd also note one thing we're doing in Brampton would be good if we could also highlight level is we've offered residents payment plans, so it's not like they're going to have to pay this all at once in September. That if they want to set up a payment plan to pay this over a longer period once this COVID pandemic is over, then we would certainly support accommodating that. And so I think if our municipalities can be synced in terms of offering accommodating payment plans for people that are facing financial duress?
Through the chair, thank you for the questions and observations. Certainly, I've started to, and staff starting to turn our mind to when we hear Dr. Lowe talk about how this could be extended by flattening the plank. It certainly suggests that the economic impact may actually be worse in the long term or the medium term than if it were to happen in a surge approach. So that's one of the challenges that we are in the process of starting to turn our eyes to, and we'll certainly bring information back to council on a regular basis, starting with the fiscal update on April 9th, where we'll start to have some of that thinking incorporated. And certainly with respect to the second question about working with, we will certainly continue to collaborate with the local municipalities with respect to the notion of how do we solve for, because people aren't likely to have all of that money sitting in their account in 90 days. So it certainly will be a challenge that we have to solve for. And we'll very much collaborate with the local municipalities on that.
Okay, thank you very much.
Thank you. Councillor Santos. Councillor Santos?
Hi there, mine is for just any further questions, like for item number 9, not for this item, but item number 9.
Oh, no, we're done. No, not yet. I'll get there in a moment. If that's the case, then we're done with option 6.3 with staff presentation. Madam Clerk, do you wish to call that vote at this time? Oh, sorry, Councillor Parrish. I don't see him, but go ahead, Councillor Parrish.
No, I just wait until the difficult ones that you have to manage there. I figure you can spot me at any time. What I'm a little bit concerned about, and I think, first of all, as a region, I think we should have coordinated our times and our deferrals and done it in a more strategic way. I think everybody jumped the gun on this, and I'm sitting here thinking we shouldn't have done that. But anyway, seniors who are on pensions, whether they be government or private pensions, they've allocated their water bills and their taxes, and they've got these little things. I watch my husband play on his computer all the time. He knows what's coming out and when it's coming out, so we don't worry about those guys. And they're probably going to continue paying. People who have healthy budgets and good incomes can continue paying. So they should all be continuing to pay so that the region and our cities have money to operate on. The ones I worry about are that big middle that in 3 months or 5 months, if they've been using that money to feed their kids, they're not going to have the money in 3 to 5 months. And so we're going to have to revisit this, because you don't let your kids starve so you can pay your taxes. So I just wish we'd slow down a little bit with all these giving absolution for water bills and absolution for this and absolution for that. The smart thing we should have done in the first place, now that I've thought about it, is we should have just left everything going the way it is. Those who can't afford to pay just won't pay. And then we deal with that in 5 or 6 months whenever it's time to deal with it in one fell swoop. So I'll vote for anything that's on the go here, but I really think we're making huge mistakes, and we're not considering those people that don't have $400 in the bank, and there are a lot of them out there. And there's going to be a lot of houses up for sale, and there's going to be a lot of people going bankrupt, and we're just going to have to deal with it when it happens. But these complicated tax things, to me, we're just playing games. We're putting sandbags where there's a flood coming.
Thank you. If there are no other speakers, Madam Clerk, over to you for the vote.
Mayor Brown?
Yes.
Mayor Brown in favor. Councillor Carlson? Councillor Carlson in favor. Mayor Crombie?
Yes, in favor.
Mayor Crombie in favor. Councillor Demurla?
In favor.
Councillor Demurla in favor. Councillor Dasco?
In favor.
Councillor Dasco in favor. Councillor Dillon? Councillor Dillon? No response from Councillor Dillon. That's an abstention. That's opposed. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
In favor.
Councillor Fonseca in favor. Councillor Fortini?
In favor.
Councillor Fortini in favor. Councillor Groves?
In favor.
Councillor Groves in favor. Councillor Innes?
Yeah.
Councillor Innes in favor. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney? Councillor Mahoney?
He's got kicked off the call a few times, so he might try to get on.
I'm just back on if you're talking about me, Mahoney, and I say yes.
Councillor Mahoney in favor. Thank you. Councillor McFadden? Councillor McFadden?
She's had trouble.
Similar issues.
Yeah.
Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
Yes.
Councillor Paleshi in favor. Councillor Parrish? Yes. Councillor Parrish in favor. Councillor Raz?
In favor.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair? Councillor Sinclair in favor. Councillor Starr?
Yes.
Councillor Starr in favor. Mayor Thompson? Mayor Thompson?
In favor?
Mayor Thompson in favor. Councillor Vicente?
Excuse me, Madam Clerk, I'm back on. I'd like to vote in favor. It's Councillor McFadden.
Thank you, Councillor McFadden. Councillor Vicente?
Yes.
Councillor Vicente in favor. Councillor Dillon, in case you'd had technical issues. Motion carries. Thank you.
Okay, thank you. That brings us down to the reports. 7-1, supporting the Region Appeals Community Agency during the COVID pandemic. And number 7.2 is the waste management response. I don't know that we need presentations. I will deal with 7.1 first. Does anybody wish to speak to 7.1? Through to the Commissioner.
Thank you, and through the Chair. Just to give you an update in addition to the report. We have convened a community response table with over 60 agencies participating. The table is leading the coordination of information, sharing, and problem solving. Virtual meetings are being held. On March 18th, a survey was sent to community partners and networks, for example, Poverty Tables, the Hunger Relief Network, the Newcomer Strategy, and many more. To date, we have received 200 responses, and by the end of the week, we will have connected with all of these agencies to determine their financial and non-financial needs, because not all asks are financial. We are working with agencies that may be having difficulty recruiting volunteers or accessing personal protective equipment. For example, our process is that we are triaging requests based on urgent need to those agencies that provide the necessities of life: food, shelter, safety, and protection. Our criteria parallels that of the province's Emergency Social Services Relief Fund. I would ask that if any councillor becomes aware of a community agency in need, that they direct them to our mailbox, COVID-19 comresponse@peelregion.ca, and I will ask to send that out this afternoon through regional clerks. By directing those requests through our mailbox, we are able to assess urgent needs across the region rather than dealing with one-off requests. I am pleased to announce that we have already funded 2 requests this week. They should be in the organization's bank accounts by tomorrow. The Compass at $6,000 and Regeneration Outreach Community at just over $34,000, enabling them to continue to provide food to some of our most vulnerable residents. As staff work with community agencies, what we are finding is that the ask is often quite different than the urgent need. In summary, then, We believe we have created an expedited process that balances urgent need in the community while ensuring our decisions are fair and equitable. Thank you.
Thank you, and I have a list of questioners: Santos, Dasco, Maderos. Councillor Santos.
Thank you, through you, Chair, and thank you so much for the update, Janice. You mentioned in your words just now that the region is working with the various agencies throughout the region, but you didn't mention whether or not the region is working also with the municipalities as well. So can you just confirm that based on our conversation earlier, and that the adjustment will be made to the terms of reference, just to again re-emphasize collaborating with some of the work that's already been in place at the municipal levels?
Yes, thank you for the question, and through the chair. So the community response process is one where we have engaged our community partners and our community agencies. The intent of having representation from the local municipalities will enable us to work together. And as soon as we have the names of 2 representatives from the last 2 municipalities, we will be updating the terms of reference.
Thanks so much, Janice. And again, I'm just on this. I know I'm nagging about it. I just want to re-emphasize the collaboration, and if possible, for cities and the region to eliminate duplication of work. Thank you very much.
Thank you.
Sorry, one more question. Sorry, I forgot. Peel District School Board, where do they fit in all of this? Because they've been very quiet. I haven't heard in any reports from the municipal level as well as from the regional level as to what the Peel District School Board is doing. That's the question I was going to ask later, but if anyone has a response now, that would be great.
Through the chair, I can speak to school boards with respect to what we are doing with our community response table. And our community response table is focused on not-for-profit organizations, so not school boards. So again, we are paralleling the eligibility criteria that we use in the community investment program. I can't specifically speak to the actions that are being undertaken with school boards.
Okay, thanks. I'll just ask that question later then. Thanks so much, Janice.
Thank you, Councillor Dasco.
Thank you, through the chair. And I just wanted to say, I was happy to hear that some funds are getting sent over to the Compass, and that was for the topic of my question, is the issue that they were having is they were running out of hot meals, and I had sent that through last week, and I don't quite know where that ended up. But the ask that they had was for some gift cards for takeout restaurants, McDonald's, Tim Hortons, etc., because their hot meal program had ended. And I'm just wondering what accommodation had been made.
Through the chair. So the $6,000 that is being flowed out to the Compass is for that very purpose. They will be purchasing food vouchers and gift cards to give out to their homeless clientele in order that they can access food. The $6,000 represents the most urgent need. I would anticipate over time, and as this crisis continues to go on, that we will have many rounds of intake looking at the needs of our community agencies. But at this point in time, it really is the most urgent of needs we're focused on.
Okay, that's great. Thank you, Nancy. Really appreciate hearing that. Thank you.
Thank you, Councillor Maderos. Councillor Maderos?
Yes, hello, Chair.
Go ahead.
Yes. Yeah, my apologies. Through the chair, thank you, Janice. I'd be more than happy to move the report. And I know, these have been challenging times from the increased workload for staff. I know staff's doing yeoman's work, and I know with our conversations, Janice, that it's been a lot to deal with and trying to manage all the various requests and so on. So I think we're doing a great job. Regarding the specific of the report and requests by organizations, how are we verifying some of these asks? And I say this gently because I find that I just want to ensure that that those who are requesting special supports at this time, that they really go to specifically the activities that are being impacted by this pandemic, and that there isn't, I don't want to use the word abuse of the system, but that asks are not just in the name of ongoing business, but using this opportunity, seeing that there's rules have been loosened, and there isn't that sort of verification process. So if you can speak to ensuring the integrity of the allocation of special funds during this period.
Thank you for the question, and through the chair, it is an excellent question. The staff that are working on this initiative have been working with community agencies for many, many years. So they are familiar with the agency, the work that they're done, the structure, the operations. By having staff reach out to each of these agencies and have discussions with them, they are able to, I'm going to say, shave the asks down to what the true urgent needs are. So in one case, we did receive a request, and after some lengthy discussion with the organization, it ended up to be 1/3 of what the original request was. We're also putting controls in place that after the fact, agencies will have to report back to us to show that they spent the funds as they stated that they would. And we are hopeful by the end of tomorrow that we will have expedited contracts available to also send out to agencies. Thank you.
Oh, excellent. And thank you. Through the chair, just lastly, Janice, in terms of communication of be it community agencies, organizations, but just people in need. Again, I think probably every councillor in one way or another are getting either requests of people in need or most vulnerable, etc. That communication in terms of the email and where we can sort of direct residents and organizations to contact the region. So there will be a communication going out and I guess social media, etc., etc.
So through the chair, at the moment, we are relying on our staff to help residents navigate the need, but as you know, there's a lot of announcements coming out almost every day. Yeah. So in addition to the programs that we provide at the municipality, such as Ontario Works, there are announcements coming out about federal help and provincial help. As I mentioned, effective on Monday, we will be starting to populate our social services page, our social supports page, which will provide clients, residents with a one-stop shop in terms of finding out what programs and services are available to them.
Yeah, that's excellent. Okay, thank you very much, Janice, and I'm more than happy to move the report, Chair.
Thank you. Councillor Parrish.
Yes, I was asked by a union, do we have a central location where, through you, Mr. Chair, where they can call or email to find out where to send money, where to send donations, where to send things that are getting dropped off? Rather than have it randomly going, at least you could prioritize the stuff as it came in.
Yeah, through the chair. Thank you for the question, Councillor Parrish. I don't have a email address or a link yet, but if you allow me, I'd like to take that question back to our REOC and see what we can do.
Good, thank you very much.
Thank you, Mayor Brown.
Thank you, Chair Unica. I just want to say, first of all, thank you, Nancy. I know a few days ago when we flagged the crisis we were facing with regeneration, your team was very quick. That is appreciated. And in terms of the value that you get with organizations, whether it's Knights Table or Regeneration in Brampton, they do incredible work. And I think when you look at that reconciliation afterwards, you'll be blown away by how effective they are with very little resources. And I can vouch for that, seeing their work firsthand. The second thing I wanted to say is, I think this would be important for regional council to appreciate the $200 million in funding for food security and homelessness. I know when I was speaking to Rod Phillips and Steve Clark a few times this week, actually, they kept on underlining that commitment and how that's significant for us. I just want to make sure that we get our fair proportion of that. You know, if you look, if Peel Region is 15% of Ontario's population, then that should be $30 million. So let's just keep an eye on that and make sure that it's not somehow diminished on its way to municipalities, because if the Minister of Municipal Affairs is highlighting this as a shining example of their partnership, if we're not getting the allocation that they suggest we should be getting, I want to be able to know so that I can raise it on my calls with them. And I know as of last night we didn't know what percentage we're getting. Is there anything new today? And when do you think we'll get to know the percentage we're going to be getting of that funding?
Through the chair, and thank you for the question. Did want to just outline to council that the $200 million, of the $200 million, $52 million of it is specifically targeted for individuals and will be flowed through as social assistance. So it's directly to individuals. The $148 million is available to service managers. At this point, we don't have any additional details. My staff were on a conference call with the ministry on Tuesday, but we are yet to receive any more information as to how the funding can be used and what Peel's specific allocation might be.
Okay, more to come. Councillor Santos.
Thank you, through you, Chair. Just a follow-up question with respect to the website development from the region for residents to apply for or to request support. So the City of Brampton started doing this already about a week, 2 weeks ago. We have an ongoing list where we are servicing various residents in need through Regeneration and Knights Table. I just want to hear about how we're going to reconcile those lists and that coordination so that we don't duplicate requests across the region of Peel. You don't have to answer now, but I certainly want to flag that because we have been delivering ongoingly now for 2 weeks to a similar process.
So thank you for the question, and through the chair, we will be linking our website to the information that is available at other websites. So not only for federally and provincially, but local municipalities, basically any area or any website that might be of assistance to our residents and clients.
Okay, great, thank you.
And the CAO may have something further on that?
Through the chair, yes, just something else as we discussed earlier. Having representation at the table from our local municipalities will certainly help with streamlining some of that work and ensuring that we are looking, at least at this table, at the entire region. So look forward to working with our local municipalities.
Thank you. Mayor Thompson. Mayor.
Yes, first of all, what I understand the concern that Councillor Santos has on duplication. I have to say, on behalf of Caledon, the streamlining processes that the Region Appeals done working with the town has been amazing, and I have not seen any duplication. In fact, I found efficiencies really come through at the levels that Nancy, you've been running, as well as the COVID committee that's run with the mayors. I want to thank you for how quick and adaptable you've been able to make that and dealing with the issues. And I'm sorry that, Brampton's having some issues, but I got to tell you, I have just been blown away on how fast and how everything's been streamlined from this side. Mr. Chair, I would like to second this motion as well. And I got to say that I understand there's some issues, but I have to say I see it differently, that it's worked extremely well here in Caledon. And, hey, there's always room for improvement. But I got to tell you, the Region of Peel has been very good working with the town, and I know other municipalities as well in Peel, trying to adapt and try to move things as quickly and efficiently. My one question is, too, I know we're talking provincially, but I know federally there's some stuff coming down the pipe. Do we know what that's going to look like yet?
Through the chair, at this point, all we have is media releases.
Okay.
Thank you.
That's concerning, and I know we're running out of time, but they're talking about April 6th, but it concerns me that the clock is running out here, and we kind of need some assurances for our residents, and I think you've heard that through Councillor Groves and Downey as well, but I think these are issues that, more than press releases, we kind of need some concrete stuff, but we'll stay tuned. Thank you.
Thank you. Mayor Crombie.
Alan, I'll just about ask my questions too. As Patrick has told you, we've been on the phone a lot with the ministers and the big city mayors of Canada and the large urban mayors. And I wanted to follow up on if the commitment for funding from Minister Ahmed Hussein for homeless and the most vulnerable in women's shelters has come through, or other than a press release that we will be receiving additional funding for those items as well.
Through the chair, so we are fully expecting that we are going to receive an allocation of funding. We just haven't received that information yet. And the ministry is connecting with us. They are arranging calls. I think they're just working through the details.
Okay. And I only caught the tail end of Councillor Parrish's question about the donations that were coming through. Was she referring to the same sort of donations for masks and gloves that I had? And do we know anything more about Ontario Together?
I was referring to a question I got from a union president who said they're all working and they'd like to contribute money, so they want to give it to a central location so it's distributed to the people who need it the most.
I wonder if Nancy might speak about Ontario Together, because there was that ethical issue of giving to where the need is rather than a local. Nancy?
Yes, through the chair, I'm happy to give an update. So Ontario Together was developed from the province, and it's to help support distribution of personal protection equipment. So that's what Ontario Together is trying to do. It's trying to look at the needs throughout the entire province and then distribute PPE equipment based on those needs. So for instance, the North may require more because their threshold or their current amount is not enough, and then they will look from there. So that's for PPE, and we are definitely, through our REOC and the work we're doing at that extended table, we are linking in with Ontario Together and determining how do we work well from a provincial perspective as well as from the local perspective, ensuring that PPE, when we receive it, when it's available, is distributed as fairly as possible. If I may,
Nancy,
yeah,
yes.
yes.
Because I think Councillor Parrish's donations were raised locally and they were monetary. So how would that be? We wouldn't send that there, because obviously the group that raised the money would want it spent it locally since it was raised locally.
As far as I know, you're absolutely correct, Mayor Crombie. What Councillor Parrish was referring to was financial donations. So we're going to take that offline, going to go back to the REOC and see how we funnel those donations. They may not be funneled to the region. There may be somewhere else that they need to go, but we're going to get some more information on that.
Thank you. Those are my questions.
Okay, Councillor Downey.
Thank you. Through you, Chair, I too just want to echo my thanks to the regional staff for working so cohesively with the lower tier municipalities. I think in these times, Mayor Thompson was quite correct. We do begin to see efficiencies to a point, and really, everyone from the community agencies are stepping up their game. Everyone, I believe, is working from a place of being that community helper and meeting the needs of their most vulnerable. I think that, we were probably all spending way too much time online the last couple of weeks, and there's lots of jokes about spending time at home with our kids and our loved ones that maybe we don't enjoy so much. But at this table, we know that there are a lot of children in Peel whose only meal is the breakfast club. We know that time in that house is maybe not the best time. And so these times then become so much more difficult for those families. And I think that the work that we're doing collectively as the upper and lower tier is noted. And I just wanted to thank you all for doing such a good job.
Thank you. Councillor Fortini.
Thank you, through the chair. Thank you to staff. I just want a quick question. For these daycares, is there any help we could do? Because a lot of the private daycares are being charged even though they're closed, and now both parents are home. Do we have any jurisdiction, or what are we doing with the daycares?
Through the chair, We do not have the ability to control whether or not the child care centers continue to charge fees. That is not within our ability or our responsibility.
Right, I figured that. So are our daycares, like all the regional ones that we have, they're all closed off the same, right?
Every child care center in Peel is closed at the moment.
Okay, thank you so much.
Thank you. With that, that exhausts my list, and as I blow by the 12:30 hour, I trust with consent, just to be official, Madam Clerk, I take the vote over to you.
Thank you. Just before we get to this vote, with the indulgence of council, Councillor Dillon, are you back online? You were offline from the previous vote, and you indicated a wish to be able to vote.
Yes, I'm back online, and hopefully the last vote I wasn't able to vote on, and I vote yes, hope it can be counted.
Thank you. We can count that. Thank you very much, Councillor Dillon. Councillor Santos, if I could clarify one thing with you as well. Last evening, you sent us a notice of motion for today, as well as a motion relating to this item 7.1. When you withdrew the notice of motion, did you also withdraw this motion?
Yes, correct. Thank you.
Thank you. With that clarification, the motion moved by Councillor Medeiros and seconded by Mayor Thompson, that the Commissioner of Human Services, Commissioner of Health Services, Director of Community Partnership, and/or Director of Seniors Services Development be granted authority to award emergency funding to community agencies from the Community Investment Program as outlined in the report from the Commissioner of Human Services and Acting Commissioner of Health Services, titled Supporting the Region of Peel's Community Agencies During the COVID-19 Pandemic, and further that the Community Investment Program be increased by $1 million from existing working fund reserves to support emergency grant payments. Mayor Brown?
Yes.
Mayor Brown in favor. Councillor Carlson?
Yeah.
Councillor Carlson in favor. Mayor Crombie?
I support it, in favor.
Mayor Crombie in favor. Councillor Demurla? Councillor Demurla? Councillor Dasco?
Yes, I support it.
Councillor Dasco in favor.
I also want to make sure that I go down as the seconder.
Mayor Thompson was the seconder. Thank you. Councillor Dillon?
Madam Clerk, if I may, it's Mayor Crombie. I thought when I read the board, I saw Councillor Dasco's name on it.
Actually, in his chair too, I acknowledged Councillor Dasco as the seconder initially, so I think that should remain as such. Mayor Thompson, would that be acceptable to you?
Yes, that's okay.
Because it was first presented from Medeiros and Dasco, and thank you for that, Mayor Thompson.
I didn't see that.
Yep.
Sorry, I didn't see that, so that's fine.
And with thanks to you, it is duly seconded by Councillor Dasco now. Please proceed, Clerk.
Thank you. Appreciate it.
Thank you. Councillor Dillon?
Yes, in support.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes, in favor.
Councillor Fonseca in favor. Councillor Fortini?
Yes, in favor.
Councillor Fortini in favor. Councillor Groves?
Yes, in favor.
Councillor Groves in favor. Councillor Innes?
Yes.
Councillor Innes in favor. Councillor Kovac?
In favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
Yes, in favor.
Councillor McFadden in favor. Councillor Medeiros?
Yes.
Councillor Medeiros in favor. Councillor Paleshi?
In favor.
Councillor Paleshi in favor. Councillor Parrish? Councillor Parrish in favor. Councillor Raz?
In favor.
Councillor Raz in favor. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair? Councillor Sinclair in favor. Councillor Starr?
Yes.
Councillor Starr in favor. Mayor Thompson?
Yes, in favor.
Mayor Thompson in favor. Councillor Vicente?
Yes.
Councillor Vicente in favor. Councillor Demurla?
She has she's gotten kicked off this call, and she's been trying to get back on to vote.
Okay, thank you.
She just sent a text message.
Councillor DeMurley, if she wants to vote in support as well, I don't know if we can do that for her. She's trying to get back on.
We'll come back to her like we did with Councillor Dillon. The motion carries. Thank you.
Thank you. That brings us down to our second report, 7.2, Waste Management Response to COVID-19. Andrew, you might like to introduce your report, please.
I'd be happy to. Thanks. Through you, Mr. Chair. Let me start with, we understand that there have been a lot of requests around, we've received them, I know you've received them, to waive our bag tag exemption or collect more waste or anything like that. We understand. But what I wanted to put out there today, and that's why we drafted the report, that everything we're doing to respond to this crisis that we're in is about balancing lots of priorities. We're balancing the health and safety of our staff, we're balancing service levels, and also balancing what residents need in their time of need. But our main objective is always to ensure the service levels that we have, the service levels we had before, and make sure they're there tomorrow and the next day. To date, things are going pretty well. I think garbage is being collected on time, recycling is being collected on time, but we can see sort of shaky times on the horizon. And we want to make sure that we're prepared for them and we don't get ourselves in a situation that puts our critical services at risk. Just today, Norm let me know that one of our key processors is dealing with an employee of theirs that has tested positive for COVID-19. And you know in your workplaces all the problems that causes. Who do we have to send home? Do we have enough people to do the work? So, and we know that's just the first. It's just kind of interesting that it happened today. But we also know that service interruptions and people having excess waste at home leads to dumping in our community. And that's the last thing we want as well. So we're doing everything we can to maintain the service levels we have. You'll see in the report that there are certain less essential things that we're going to stop doing, bulky items, some of the things that our CRCs we're not collecting anymore, that are either putting our staff more at risk of having to contact with the residents, or just we see them as things that aren't dropped off as often. So that's what I wanted to start with, and I'd be happy to take any questions.
Thank you. My list is Sato Parish Santos. Councillor Sato.
Thank you, Mr. Chairman, and thank you, Andrew. First, I want to thank Norm over the last 2 weeks for responding to my emails back and forward, especially with regard to the exemption periods and waiving the fee for garbage bags, tags, sorry. You know, we're facing a situation here where we are seeing increased dumping. I'm seeing it in my parks, in the garbage bins that are beside bus shelters. Staff have actually removed quite a few in my ward already because we're getting excessive dumping, and that's before we implement any restrictions. But I understand the concerns that you've raised in the report. I think are very valid. I did take heart that you said in the report that you would introduce exemptions as prudent. Now, also in the report, and I'm trying to find it in front of me, I had flagged it earlier, and I'm sorry, I just can't find the page, that one of the items that, it's on page 72-3. Depending on the ability of the contractors to meet service demands, the region may suspend the collection of other material streams. And one of those, I can understand yard waste. I think people can live with that. But the concern would be the suspending recycling collection. Can you clarify if that would, is there a risk right now, a concerned risk to the people who are sorting the recycling as it comes into the facility?
Through the chair, thanks for the question. This was put forward in the report as just information for council. If we get way down the road and we started to see staff shortages either in processing facilities or in collection with any of our vendors, we may start collapsing our service to one service that we collect everything in one bin, which would be in a garbage bin. So it was not meant to flag a risk in recycling facilities. A lot of our new MRF that is just coming up online now, it's a lot more automated than it used to be. So we actually could produce more for better quality with less people touching things.
Okay. I understand the balancing the service and the needs. You know, as Dr. Lowe said earlier, that everyone has to do their share if we want to get through this. And it's a hard message to give our residents sometimes, but I think it's one that the majority of people are accepting right now. They may not like it, but if it's explained carefully, I think we can get them to accept it as things move forward. The recommendation is that we give you the authority to make these decisions. I would ask, however, that prior to, sorry if you can hear my dogs barking, I am in a room upstairs, doors locked and everything, but they're loud. I would ask that before any of these decisions have been fully made, and before any communication goes out to the public, that members of council be advised of any pending decisions with a good lead time and full explanation of what's going to happen, when it's going to happen, and why it's going to happen. You heard us when we were caught, when the signs went up about the grass clippings, that we were caught unawares and had to really scramble. And I think in this particular case, this would be even more drastic. So I would want very clear direction to staff that that occur before any changes are related to the community. And I agree we need to take care of our contractors. They may be private, but they're an extension of our employees, and it's very critical that we make sure that they are safe and that our residents understand that. So thank you for all the help that you and Norm have been giving during this time. That's all, Mr. Chair.
Thank you, Councillor Parrish.
Well, I'm very concerned about the second batch on the same page where it says suspend recycling collection. That can go in your garage if you've got a garage, or it can go in your basement if you've got a basement. So I wouldn't be in a hurry to suspend that. I might give them a notice saying, hang on to it until this is over. The third bullet, directing residents to put green bin organics in the garbage, just makes me shiver. We spent so much time training people to keep those things separately. I hope we don't get to that. But I do understand that if bad gets to worse, then that's what's going to have to happen. I'm going to ask a dumb question because I thought when I asked Nancy, through you, Mr. Chair, I shouldn't ask dumb questions through you, no. When I asked Nancy about an online location for donations, I was surprised to hear we didn't have one. So I'm going to ask you, we're not charging late drops on trucks at the yards when they're finished their day at 8 o'clock at night, I hope.
Correct. We're being very respectful and lenient with our vendors.
Good. I think this is an opportunity to show them that we appreciate what they're doing. I watched a guy this morning at 5 to 7. My neighbor yesterday put an 8-foot couch out, and it was upended. And this poor guy, single guy on the truck, got out, threw the cushions in the big scooper by himself, threw the couch, got the couch up there, and threw it in the back. I would have left that couch there, and I would have put a nasty note on it. But they are working hard. They're the most unsung heroes in the whole system. I mean, we're happy about the grocery store stockers and the people that are driving trucks, but the guys that pick up the mess at the end, I don't think we ever thanked them enough. So just hoping we're really cautious about those points I made and we don't fine anybody for late pickups.
Thank you, Councillor Santos.
Thank you, through you, Chair. Quick question for Andrew. Are you guys, so I signed up and I received text messages of garbage pickup reminders every single Wednesday morning at 6 a.m. The city of Brampton is also exploring using text messaging technology to keep residents up to date regarding COVID-19. I'm wondering if, it's just a suggestion, text messaging with the huge list that you guys have from the region as a way to communicate just not only changes to the garbage and waste pickup, but also in terms of COVID-19 urgent updates.
Yeah, through the chair, I'm happy to take that back and work with our staff to make sure if there are any channels we're not using, we'll talk to the REOC and make sure we use them all.
Thank you.
Thank you. Next on my list is Councillor McFadden, and you're all aware that on our agenda, she has a related notice of motion regarding curbside waste collection. Councillor McFadden.
Thank you, Mr. Chair. Would I be able to bring up my motion at this time?
Yes, why don't you speak to it, and then we'll decide how we deal with it beyond that. Go ahead.
Okay, thank you very much. Certainly, I appreciate all the work that Norm has done on this, and I appreciate our recycle and garbage workers to the nth degree. I agree with Councillor Parrish that they work really hard and they should be given kudos all the time, not just during this time. But our landscape has changed over the last couple of weeks, having all the university students home now, having all the college students, having the kids home, having your spouse home, and we're generating a lot more garbage. And what that is now happening, and I know Councillor Sato said this too, is that if they don't have room, they're dumping it in our parks, which in turn puts extra pressure on the city to then go out and clean the parks up of all the dumping. So I don't think that this is the time where we should be reducing our service to our residents. And again, I think that our garbage and recycle is an essential service. I think that if we reduce pickup, we're going to have problems with health, having extra garbage around. And if not there, certainly in our parks. And I think that, personally, I think we should increase it as my motion states.
Thank you, and Councillor, I will deal with that at the appropriate time as instructed by the clerk. Councillor Paleshi.
Thank you, Mr. Chair. I just wanted to just say to Mr. Farr, thank you for the update. I guess we're in a difficult time, but that being said, we're not savages. I think that recycling can still go on. I support giving the power and opportunity to make changes as you see fit. I just want to ensure that recycling remains a priority on behalf of the Region of Peel, and I'm sure that you agree, and I'm sure all members of council agree as well. The one other item that I wanted to, just in relation to Councillor Santos's remarks, currently we have our Region of Peel signs that are still showing communications on grass clippings. Can I have us as the region go out and immediately change those signs over to the COVID awareness signs that other municipalities are doing, and Peel Public Health information or whatever the region sees fit into having those having whatever on the signs as a form of communication?
Thanks for your question, Councillor Paleshi. We actually changed out all 16 of our signs yesterday with shared messages around people not using parks, and also some signs around not flushing wipes, etc.
Well, thank you very much. See, I was distancing myself yesterday, and I wasn't out and about, so I didn't see those changes. But thank you very much. Thank you, Mr. Chair.
Okay, my list is Sato, Parrish, Raz, McFadden. Councillor Sato.
Thank you, Mr. Chairman. I assume we're speaking to the motion at the same time, are we, since Councillor McFadden spoke to it?
I'm advised by, Madam Clerk, why don't you take a moment now and explain how you'd like to deal with the matters?
Should be speaking to the motion that is on the floor now that was moved by yourself, Councillor Sato.
Okay.
Do we have a seconder for that motion? Councillor Parrish is the seconder. So that is the motion that we should be speaking to this time.
Okay, thank you. I would like to say that I'm not going to support, when we get to it, Councillor McFadden's motion, although I had made the same request to staff over 2 weeks ago when my residents were asking me for it. However, I would like to include, if we can, and I don't know whether it should be wording in this motion, to staff. Andrew, you said that you would look at, and I'm sorry, I'm just going to grab my notes that I was jotting down here. You did say in the report that staff would introduce an exemption as prudent. So I would like to highlight that in the recommendation in some way. Maybe it's that staff would, that staff be directed to consider having an exemption period if they deem that it is safe for the contractor, some kind of wording like that. That way it can be in the same motion where we are giving you the authority to make changes as things are moving along. Would that work, Andrew?
Yes, thanks, Councillor Sato. I can certainly work with that.
Okay, I think that would, I think it would give me comfort that you're going to do your best to do the exemption period, or waiving the tags is basically what we're doing. But I just don't feel that council, as a councillor, I can be directing you today to do that. 2 weeks ago when I first asked the question, I felt that I did want to direct you to do that. But having read the report, I think we have to take heed of the information you're giving us and trust that staff will work to assist residents as much as possible with regard to the waste. Thank you. And yeah, I'm just reading the addition. Be direct to consider having an exemption period. Should doing so be deemed to be, I guess it would be practical and safe for the contractor. I'll leave the wording to you. Thank you, Mr. Chair.
Thank you. Councillor Parrish.
Again, a camel is a racehorse designed by a committee, but I'm going to do it too. The two that I mentioned that upset me are the green garbage going in with the regular garbage and the fact that we're going to mix recycling. So in that first red amendment, could we put, no, I'm at the paragraph before that. Council be advised a decision is imminent and consult it. You can do it by phone, you don't have to call everybody in. But if you're at the point where you're mixing green garbage into regular garbage, I want to know about it before you announce it to anybody. And I want you to take my opinion into consideration. So council be advised the decision is imminent and consult. Or imminent, comma, the rationale in the implementation timeline and consult with each councillor by phone.
Councillor Parrish, I'm good with that as a friendly amendment to the motion.
Good.
Okay, good. Moving on. Councillor Raz.
Oh, I'll wait till you to the end.
I apologize, Councillor Raz. Andrew may have had a thought on that. Andrew?
Sorry, I know I'm not a councillor, and through the chair, then I'm not able to make necessarily amendments on the go. But if to make sure we have some flexibility and we do our business, and I don't know exactly how to word it, I can go work with these folks here. We make small changes all the time. As you know, even you can see this report, we've made small stuff. But certainly any changes around major levels of service, which would be changing recycling, garbage and green bin, I would be more than happy to commit to that.
Well, the way to fix that is advise that a major decision is imminent. That make you happy? It's like,
Thank you.
it's starting to look like a really nice camel.
Yeah. Thank you. Back to Councillor Raz.
Thank you very much. Can you hear me?
Yes, I can. Go ahead, Councillor.
Okay, thank you. Sorry. I have the headset on. I'm just trying to consolidate or try to address Councillor McFadden's concerns. I think the key, knowing that how fluid our situation is, we need to be able to give staff ultimate flexibility, and if there's personal personal health issues by the workers or that they're not able to service, then something has to give at some point. So I guess the challenge is how would we get the region to waive the garbage waste limits? And we don't want them going out putting stickers on everything saying I'm not going to collect it, because the less time they can get out of their homes the better. But I would agree with all the comments that with everybody home, we're just generating a lot of garbage. So we need to stay up on top of that waste streams to ensure that things don't get dumped everywhere. So we're dealing with the 7.2 right now, correct? So
Yes.
are we debating
Yes, we are.
McFadden's motion as well?
No, we're strictly on 7.2 right now.
Okay. That's fine, then I'm happy with the changes that Councillor Parrish put forward. Thank you.
Thank you. And Councillor McFadden.
Thank you very much, Mr. Chair. I think I want to reiterate that I am certainly concerned about the health and welfare of our collectors at the Region Appeal. But I'm also concerned about the ramifications of the health issues when they drop the garbage in our parks. And then both Brampton and I guess Caledon and the City of Mississauga's parks people are put in a position where they have to pick it up. So there has to be a balance here, because someone's got to pick up this garbage and it's being generated. So is there a way that we can incorporate, like Councillor Bass was just saying, maybe the limit being increased? I'd be happy with that, because this is only going to get worse if people can't leave it at their at the end of their driveway. Those are my comments.
Thank you. If I have no other speakers, Madam Clerk, over to you to administer the vote on 7.2.
Thank you. On vote 7.2, moved by...
Sorry, Mr. Chairman. We had amended it to, I realize you're saying council be advised, but the wording in the first amended paragraph that I asked is not what Councillor Parrish and I requested. It should be in further that prior to any major decision being implemented,
Yes.
that council be consulted. And then the further that we be advised earlier. I think the major part should be first. I think that's the critical part of that. That they consult with each councillor by phone, and then that council be advised prior to a decision being communicated, or prior to a change being communicated.
Councillor Sato, are you content with the wording now, that it's got the major decision at the beginning? It's got the advised imminently as well as consulted by phone?
I would rather see consulted by phone after members of regional council. And the advising would follow Sorry, my screen just popped to one of the counselors. I'm not seeing it in front of me anymore.
Trust me, Pat, it looks fine.
Okay, thank you. Oh, there it goes. Okay. Okay, thank you. That's good.
Thank you. One more speaker, Councillor Innes.
Thank you. My question with following up on the discussion about dumping, in Caledon in particular, we have a burn ban on a lot of our estate properties in the area that I represent. Take out their burn permits to actually burn their yard waste, which is not possible during a burn ban, which we have in place just to protect our emergency resources, which goes to support what Andrew is saying, that we need to protect our waste management resources to the best of our ability. So one of the questions that residents have been asking, if the tipping fee for yard waste can be waived during this period of time.
I think Norm's on the phone, and him and I actually had a discussion about it. Norm, I don't want to put you on the spot, but can you give a little bit of commentary on that?
Norm, can we hear you? Or can
Sorry,
you?
yeah, sorry, I'm right here, and I apologize, but I just changed my screen and lost my mute button for a few seconds. Sorry, so the residents in the Bolton area are allowed to bring yard waste. I mean, in the urban areas, I don't think they'd be burning. I don't think they'd be burning yard waste in the urban areas. I assume this is for the rural areas that we're talking. And the Caledon Community Recycling Center already allows residents to drop off 150 kilograms of yard waste for free during any visit. So I'm assuming that would take care of this. If a resident has yard waste, they could bring it to the Caledon Community Recycling Center to drop it off. We've waived fees in their entirety before at the Caledon Community Recycling Center, and what we found was that it attracted a large number of landscaping companies from maybe beyond the Caledon borders to take advantage of that. So we're a little reluctant to go back to that, but there is 150 kilograms per visit free right now, so I'm not sure if that meets the needs of these residents right now.
Okay, thank you. And maybe what we'll do is I'll work with some of my other regional councillor colleagues in Caledon to get that message out. And just wanted to say that I support the initiatives of being cautious as we move forward, because I think that there is a good chance that this will only get worse, which is going to cause an even more significant burden on our residents. And when I've spoken to residents who've asked me for additional bag tags or increasing the pickup or any of those other services that we provide, and I explained to them that we're trying to make sure that we continue to have the resources necessary to maintain the current service level, they've all understood. I think it's just on our part to take that opportunity to have those conversations with our residents to make sure that they understand why we're not increasing, and to keep being diligent about the dumping situation. I know it's, everybody has dumping in their parks. We've been having dumping on Caledon side roads for as long as I can remember. So I think we just have to keep watching and make sure that you report the materials when you actually find it being dumped. Thank you, Andrew, and your entire team at Waste Management.
Thank you. That exhausts my list. Madam Clerk, over to you.
Thank you. So the motion moved by Councillor Sato, seconded by Councillor Parrish, that the Commissioner of Public Works be authorized to adjust waste management services as required in response to COVID-19 to ensure the safe and efficient delivery of waste management services, support physical distancing, and protect the health and safety of workers and residents. And further, that prior to any major decisions being implemented or communicated to the public, members of Regional Council be advised that a decision is imminent, the rationale and the implementation timelines, and consult with each councillor by phone. And further, that staff be directed to consider having an exemption period for garbage limits and or bag tag fees should doing so be deemed prudent. And further, that the Commissioner of Public Works be authorized to amend existing contracts related to waste management services and enter into new contracts related to waste management services on a directly negotiated basis as may be required, as deemed necessary by the Commissioner in response to COVID-19 to ensure the safe and efficient delivery of waste management services on business terms acceptable to the Commissioner of Public Works and on legal terms acceptable to the regional solicitor. We'll take the vote. Mayor Brown?
Yes.
Mayor Brown in favor. Councillor Carlson? Councillor Carlson in favor. Mayor Crombie?
I support.
Mayor Crombie in favor. Councillor Demurla?
Yes.
Councillor Demurla in favor. Councillor Dasco?
Yes.
Councillor Dasco in favor. Councillor Dillon?
Yes.
Councillor Dillon in favor. Councillor Downey?
In favor.
Councillor Downey in favor. Councillor Fonseca?
Yes, I support.
Councillor Fonseca in favor. Councillor Fortini?
Yes, thank you.
Councillor Fortini in favor. Councillor Groves?
Yes, I support.
Councillor Groves in favor. Councillor Innes?
Yes.
Councillor Innes in favor. Councillor Kovac?
Yes, I'm in favor.
Councillor Kovac in favor. Councillor Mahoney?
Yes.
Councillor Mahoney in favor. Councillor McFadden?
Yes, I'm in favor.
Councillor McFadden in favor. Councillor Maderos?
Yes,
Councillor Maderos in favor. Councillor Paleshi?
I am in favor.
Councillor Paleshi in favor. Councillor Parrish? Councillor Parrish in favor. Councillor Raz? Okay. Councillor Sato?
Yes.
Councillor Sato in favor. Councillor Santos?
Yes.
Councillor Santos in favor. Councillor Sinclair?
In favor.
Councillor Sinclair in favor. Councillor Starr?
Yes.
Councillor Starr in favor. Mayor Thompson? Mayor Thompson? Councillor Vicente? Councillor Vicente?
Yes, thank you.
Councillor Vicente in favor. Councillor Raz? Motion carries. Thank you.
Thank you, Madam Clerk. Do I carry on, or do you want to deal with the notice of motion at this time that was? Let's deal with the notice of motion at this time because it is related. Madam Clerk, over to you. I have speakers first to the notice. I have a list. Councillor Parrish.
Yes, I think the motion we just passed covers that. I understand Councillor McFadden's intentions, and I'm sure it'll be considered as part of that motion that we just passed, so I won't support it.
Thank you. Do I have any other speakers? Do I have a seconder?
Mr. Chair,
Yes.
I would like to withdraw my motion. I'm quite satisfied with the motion that passed before this, and I trust that we will be consulted moving forward.
Very good, and thank you for that. Okay, with that then, I come down to communications item 8.1. David Wojcik, President and CEO, Mississauga Board of Trade, who I think we're going to have good news for today. Do I have anything, several more, Madam Clerk? Why don't you enunciate them as well, the additional?
All of the communications are 8.1 from the Mississauga Board of Trade, and then 8.2 is the communication from City of Brampton. 8.3 was the communication from the Town of Caledon. 8.4 was communication from the City of Mississauga, and 8.5 was additional communication from the City of Mississauga.
With receipt moved by Councillor Sinclair and Councillor Carlson. Do I have any speakers? Call the vote, Madam Clerk.
If there are no objections,
Sorry, Mr. Chair.
Yes. Madam Mayor Crombie?
Sorry, Mr. Chair, it's,
Yes, please proceed.
sorry, it's Councillor Sato.
Councillor Sato, sorry, go ahead.
Yeah, Catherine, did you include in receipt the additional 2 motions that were sent by Mississauga to you this morning?
yes, I did included it at 8.5.
Okay, thank you very much.
Thank you.
And if there's no objections, moved receipt carries. Thank you.
Very good. Down to item 9, other business or council inquiries. Councillor Santos.
Sorry about that. Just a quick question through you, Chair. Has anyone been in, like, does anyone know what's happening with the Peel District School Board? Have they reached out to us at the region, or is there any update that anyone can share regarding what they've been doing in terms of outreach to schools, etc.?
The consensus seems to be from my commissioners' faces that the answer is no.
Okay, thank you. Just as a suggestion, it might be great just to follow up with them, because with all the school closures that happened, I know that through the City of Brampton requests from residents, many of them are those kids who used to rely on the lunch programs. So we have been getting requests directly from schools to help support those kids. It would be great to loop them in or try to find out what they're up to.
Through to staff?
Through the chair, I can just provide a quick update. I think it was 2 weeks ago, we did reach out to both school boards. It was Chair Yanika on behalf of the region to set up a meeting for discussion with the school boards. We haven't received anything yet. I'm going to assume they're crazy busy trying to understand how to deal with the rest of the school year, but we will continue to make that contact as we've started.
Okay, thanks so much.
And Kathy, Commissioner Granger, did you have something on that as well?
Well, the only other thing I'll mention is that the Community Safety and Wellbeing team, those contacts are still meeting, not as formally as they were before. So we do have some links on there with the school board. So we can certainly, Councillor Santos, reach out and see how things are going there. So there is that contact as well. Thank you.
Thank you. Councillor Sato?
Thank you, Mr. Chairman. Just an inquiry, is it the intent of for us to meet as a council at the region on a regular basis? We are continuing in Mississauga to hold our meetings every Wednesday, virtual meetings, and it would be helpful, instead of last minute calling special meetings, if we continued to be scheduled at the region as well. I wasn't sure if Catherine explained that at the beginning or not.
We can schedule meetings as required through updates. We're going to have updates on each of the council meetings every 2 weeks. There's the communications that are going to be coming from the CAO, as well as the as Dr. Lowe. And if meetings are required to be called, we can call meetings as they come.
No, I guess my inquiry really was, are we fully scheduled for a council meeting at the regular time in 2 weeks?
Yes,
I just want to make sure that I have it in my calendar.
Yeah, no. Yes, we are.
Yes.
Yeah, there's been no.
Okay, that's all I needed to know.
Okay.
Yes, thank you. Okay, with that, that brings me down to 11, the bylaws. Madam Clerk, I'll have you bring us home.
Thank you. The next resolution, moved by Councillor Parrish, seconded by Councillor Sinclair, that the bylaws listed on the March 26, 2020 Special Regional Council agenda be given the required number of readings, taken as read, signed by the regional chair and the regional clerk, and the corporate seal be affixed thereto. Are there any objections? Hearing none and seeing none on email, carried. Moved by Councillor Sinclair, seconded by Councillor Downey, that bylaw 29, 2019, to confirm the proceedings of Regional Council at its special meeting held on March 26, 2020, and to authorize the execution of documents in accordance with the Region of Peel bylaws relating thereto, be given the required number of readings, taken as read, signed by the regional chair and the regional clerk, and the corporate seal affixed thereto. Any objections? Hearing none and seeing none on email, carried. And finally, moved by Councillor Downey, seconded by Councillor Parrish, that the March 26, 2020 Special Regional Council meeting, you wanted to do something though, council meeting be adjourned. Any objection? Hearing none, carried. Okay, thank you.
And only to say thank you to the staff and all the technical folks that got us through this. Well done under the circumstances. We stand adjourned. Thank you.